Today we are having the blood and organ donation committee meet. We are starting now, and we will have the IMA prayer and physician's prayer, which will be recited by Dr. Rashmi, one of the active members of our eye donation. Madam, Rashmi Madam.
Good afternoon, sir. Good afternoon, Honorary State President Dr. Sridhar, sir, State Secretary, sir, Ravi Mohan, sir, State Finance Secretary, sir, Solomon Jaya, sir, and respected Chairman, Blood and Organ Donation Committee, Dr. Rajesh Babu, sir. Can I carry on with the IMA prayer, sir?
Yes, madam. IMA prayer, physician prayer.
IMA prayer. May everybody be happy. May everybody be healthy. May everybody be free from pain. May everybody be free from sorrow. And may we be the healing cure beyond every guide and lure. Physician prayer. Dear Lord, thou great physician, I kneel before thee, since every good and perfect gift must come from thee. I pray, give skill to my hands, clear vision to my mind, kindness and sympathy to my heart. Give singleness of purpose, strength to life, at least a part of the burden of my suffering fellow men, and a true realization of the rare privilege that is mine. Take from my heart all guile and worldliness, that with the simple faith of a child I rely on thee.
Thank you, madam.
Thank you, sir.
Now we will have the welcome address from me. I am the chairman of the Blood and Organ Donation Committee. So I welcome you all. Today I welcome our President, Dr. Sridhar sir, for the nice session which we are going to have as eye donation, IMA Eye Retrival Center. I welcome the immediate past President, the Dr. Sengutuvan sir, and President-elect Dr. Ravi Kumar sir, and the IMA's present secretary, Dr. Tiraviyam Mogan sir, and the finance secretary, Dr. Solomon Jaya sir, and I welcome the advisor for the blood and organ donation committee, Dr. S.S. Sukumar sir, the past president of IMA. Today I welcome also the main speaker of the day, the president of the Ophthalmic Association, Dr. Sujatha Mohan, and moderators for the program, Dr. Srish Kumar, Dr. P. Sumati, Dr. Prabhu Vijay Raghavan, Dr. K.S. Siddharth, Dr. B. Kosalram, Dr. Shalini, Dr. Rashmi, Dr. Nirmal Frederick sir. I welcome you all for the program. Today, I wanted to tell about what is the Blood and Organ Donation Committee of IMA Tamil Nadu. What we are doing in the IMA Tamil Nadu, the Blood and Organ Donation Committee, this year, this is our committee. We have the advisor as Dr. S.S. Sukumar, and the members of the program are Dr. Bomusami from Avinashi Tech City, Dr. Harivira Vijaykanth from Avinashi Tech City, Dr. Rashmi from Sivakasi, and Dr. V. Jayaraj from Madurai, Dr. G. Murugan from Dharmapuri, Dr. P.R.V. Tirumurthy from Pollachi, Dr. B. Vijay from Mudumalpet, Dr. Sadasivam from Pattukotai, Dr. R. Vinod Kumar from Kadalur, and Dr. T.N. Sai Meenakshi from Chennai Tambaram. I welcome you all, and this is our organ donation committee which we are going to do actively. And for the organ donation committee, initially we started with an emblem where it is showing 2 green signals, which is organ donation emblem we have put. And subsequently, the last year it was joined as a blood and organ donation committee. So we have added the blood also here. And this is our emblem, which is showing the blood and organ donation committee. And this is one example from one of our participants, the presidents of the Ambattur Avadi, Dr.V.Veena. She used to do lot of activities every time, and this is one such activity which she has done. In plant and leaves, he has drawn a diagram like this. Light up a life, donate eyes. Like Vala Ilai, made in Vala Ilai, motivation, donation. She has done like that. And this is an example I wanted to show how our presidents are more interested in doing the things. And our main thing is every month we wanted to do, last Tuesday of every month, we wanted to do the blood and organ donation committee meeting and the eye retrieval 3 meetings till June we wanted to do so that it spreads like anything. And all the president, secretary, and finance secretaries of all branches should make it possible to attend the meeting, and also they need to communicate and spread messages about the conduct of the meetings to all the members whenever communicated by WhatsApp and email. Request the state office also to send the mails about the meetings of for the all the branches so that we will have lot of people attending the program. The we want all the people to conduct organ donation awareness meets in their IMA areas, to conduct organ donation awareness meeting in all the medical colleges, nursing colleges, all the engineering colleges, Rotary clubs, Lions Club, and like forums in their IMA regional areas. And we have prepared the two pamphlets. One is in English and another is in Tamil, which is showing all the members of the list and all those things and about what is organ donation and everything is written there. And like that also, we are going to create all the new pamphlets also. So to increase the awareness, if a person with the brain death donates the organ, the branch IMA office bearers, I request them to meet the relative during the funeral or after in their home and thank them by giving a citation so that more people will be joining the program, donating the organs. This is like our chief minister in 2 years back has announced that those who are donating the organs will be given the last rites, the felicitations will be given at their house by the government officials. Like that, the dean of the medical colleges, the tahsildar, the revenue inspector, or sometimes collector also giving the citations to the patients so that it spreads like that. And I request all the IMA branches in their meetings to allocate 5 minutes to be allocated to the talk about the organ donation in each meeting in the form of a show the PowerPoint about organ donation. If there is any organ transplant specialist in their branch, request them to talk about their experience during the month. And if not available, we can invite from nearby branches to give the talk. Show the waiting list of organ necessity to obtain list from the TRANSTAN and show it to all your meetings. To observe 1 minute silence for the brain death donor who has donated the organ in that region. Like that, if you do all these things, it will spread the message like that. And this is one of the blood donation activity which has already been started from Erode branch, where on 7/1/2026 blood camp at Erode College of Pharmacy, they have collected 96 units of the blood already collected. So our people are fast started their works. And organ donation meet which was conducted at Vellore IMA 10th January 2026. Udaluruppu Vilipunarvu. The organ donation awareness program was conducted for the Pallikonda Tool Plaza and highway workers, and pamphlets on organ donations were distributed to them and to the public traversing the tool booth. And the main thing is regarding the eye donation, we wanted to popularize more to the public. For that only we are having this meeting also today. And IMA Eye Retrival Center. Create the team in Tamil Nadu, educate more people for eye retrieval, and ophthalmologists, interested doctors, paramedical staff, nurses in each district and branch areas. We wanted to educate them so that we will have a lot of eyes in excess to start more eye banks or eye retrieval centers in Tamil Nadu. That is our aim. Minimum 10 retrieval centers we are planning this year. And hospital coordination meet to conduct regional donor hospital coordination meet by inviting donor, recipient, transplant hospital doctors, and conduct meeting once in a month with the organ donation committee members of IMA TNSB. And this is regarding the TRANSTAN. TRANSTAN is the authority which are alerting the organs. The Transplant Authority of Tamil Nadu request all the IMA members to visit at least one time to this website to know more about the organ donation. And then to pledge the organ, Aadhaar verification and follow instruction and download the card. And the registry created in Tamil Nadu IMA also. And this is the donor card which previously they were issuing from the cadaver transplant program Tamil Nadu. And this is the new method how to download it, which is given in our books and all those things we have issued. And those who have a doubt, you can ask me. They go to the TRANSTAN and follow the instruction. For there will be a place called donor pledge. There you have to put it and then we can download the card like that. And then this is go to TRANSTAN website and the donor pledge, and then form 7 for organ or tissue pledging will open. Register to pledge will open, and then Aadhaar verification and all those things we need to do. That's how we download. This is the card which I have downloaded, and in that the organs which are all there, it will be mentioned, and it will be like this only. And this is like this. And then this is the old card and this is the new card which is downloaded. And to increase awareness about organ donation, the Timacon awards for the good performance, branches with maximum donor registration in our website, and branch conducting maximum donor awareness meetings to be given during the state conference Timacon 2026. And this is the from the website, the TRANSTAN Transplantation. So far, there are about 12,413 transplants have already been conducted. And this is the waiting list which is carrying, of which the kidney is more. And even now also this Chief Minister Comprehensive Health Scheme also is covering it. And then Tamil Nadu state is to provide final assistance up to 22 lakh for any transplant through the Chief Minister Health Scheme. 588 end-stage organ transplantation patients have benefited from the Chief Minister's Comprehensive Health Insurance Scheme. And this is regarding a skin donation activity which is happening at Coimbatore on 6th January 2026. That is their serial number of 392 skin harvest is being done from a patient in the home. They have harvested at home. The skin is given to Ganga Hospital, eyes to Sankara Eye Hospital, and the doctors and then the nurses which accompanied them. And then this is regarding in Coimbatore Medical College Hospital recently on January 18th. There is a brain death certification which is done and 5 people got the life like that. And நாட்டுத்துறையின் உடலுக்கு கோவை அரசு ஆஸ்பத்திரி டீன் கீதாஞ்சலி தலைமையில் டாக்டர்கள் நர்சுகள் மலர் வளையம் வைத்து மரியாதை செலுத்தினார்கள். This is what we are telling about it, so that people will be the brain death and organ donation. Then another transplant which is being done on January 22nd. From Madurai, the organ is transported to Tanjore. Within 2 hours, they have transported the organs. This is what they have done. Then another one is the brain death and organ donation in Ramanathapuram government thanking on 25th January 2026. Then this is one body donation which is being done by Dr.Sundaravadivel, donating his body to alma mater of the Tirunelveli Medical College October, as per his visit was done. And like that, this is a video which is being published in the movie Chennai Urnal. So like that, So like that, we are thinking about creating a new video also this time. Like that. Oh, thank you. So now I request our President Dr. Sridhar sir to give his presidential address and inauguration of the program.
Thank you, Dr. Rajesh. Am I audible?
Yes, sir.
You're audible, sir.
Yeah. So, Chairman of the committee, Dr. Rajesh Babu, my dear own HSS, Dr. Perevi Mohan, Treasurer, Dr. Salman, my dear brother, Dr. Koshal, all the team members of the Eye Retrival team, Nirmal and the other friends from my own profession. Though I am the president to state IMA, Dr. Sujatha Mohan happens to be my president in ophthalmology. And I greet her with all my happy heart. And I thank her for allotting time to throw some light into the eye retrieval program. I think everybody knows, especially the ophthalmologists know, the difficulty of getting enough number of eyes for transplant. And there is a general myth among the public that when eye is donated, the whole of the eye is being used for transplantation. That might have to be broken, making it very clear it is only the cornea, the black part of the eye, which is used for transplant. And more than the ophthalmologists, all the other general practitioners and paramedical, high qualified paramedical should learn this eye retrieval at one stage so that we raise the harvesting number of harvested eyes in all of Tamil Nadu. Generally, it is only the Jains and Buddhists who voluntarily come for eye donation. This should change, and more number of Hindus to come forward for eye donation. All these things need a lot of creation of awareness by our state IMA and all the TNOA. Towards the public, they should be taught the big benefits of eye donation. And I think this is the right step Dr. Rajesh Babu has taken. And now we have a star speaker. Let us hear to her what she has got to tell us. Over to you, Rajesh. Dr. Rajesh, over to you.
Sir, thank you, President sir, for the nice words. Now I invite Dr. P. Sengutuvan sir, the immediate past state president, to give his felicitations.
Thank you, Rajesh Babu. Respected advisor of the Blood and Organ Donation team, Dr. S.S. Sukumar, and President IMA, Dr. Sridhar, Chairman of the Blood and Organ Donation Committee, Dr. Rajesh Babu, Secretary, Dr. Dravi Mohan, Treasurer, Dr. Solomon Jaya, and the committee members, Dr. Nirmal Frederick Rashmi, and other members and the speaker and moderators. Eye retrieval program is one of the most important, and Dr. Rajesh Babu will do it effectively in the program. Already he has been 1 year as the chairman of the Blood and Organ Donation Committee, and he is continuing this program as very well. So, best wishes to him, and thank you for the opportunity. Thank you, sir. Over to Rajesh Babu.
Thank you, President Dr. Sengutuvan sir. Now I invite Dr. S.S. Sukumar sir, the advisor for the Blood and Organ Donation Committee.
Dear President Dr. Sridhar, TNA President Sujatha Madam, Past President Dr. Sengutuvan, Dr. Rajesh Babu, Dr. Perevi Mohan, Dr. Koshal Ram and others. It's Dr. Rajesh Babu's enthusiasm for the past 2 years as AMS chairman also is really too good. He is planning for opening retrieval centers at many IMA branches. Here, even here, we have started an eye bank apart from RSN Eye Bank and Govt Eye Bank. We are waiting for some few papers. Once it's come, the new branch, new eye bank will start functioning. The third eye bank will start functioning in Europe. Retrieval centers. Dr. Reshmi so much interested not only in this, she's interested in skin bank also. When we are promoting eye donation, we can even talk to the people about skin donation also. Can only get promoted. And to promote more of eye retrieval centers, we request all the IMA branches on 15th, there is President Secretary's meet, leaders meet is there. They can be motivated, all the President Secretaries of all the zones can be intimated and can be encouraged to start it. With few words, I thank everybody and let me hear from Dr. Sujatha. Thank you.
Thank you, Dr. Sukumar sir, for your nice words. Now I invite Dr. A.K. Ravikumar sir, the State President-elect 2026. Dr. Ravikumar sir? Sir is not there. Now I invite Dr. M. Mohan sir, the Honorary State Secretary of IMA TNSB for the felicitations.
Good afternoon, Rajesh Babu sir. A warm welcome to all the dignitaries and the delegates. I thank President Dr. Sridhar sir, past President Sengato sir, Sukumar sir, and the team of IMA TNSB for taking this eye donation as the eye donation and IMA Retrieval Center. This topic, I should especially thank Rajesh Babu for taking interest in making this program a great success. We have been having earlier two IMA meetings to organize this program. So as I feel eye donation gives us gift of sight and hope. Today CME will strengthen awareness and action. Thanks to the organizing committee, wishing the program a great success, and especially thank the speaker of the evening, Dr. Sujatha Mogan, for coming here at this busy hours and spending this time on talking about this topic. And once again, thank you all for giving me this opportunity, sir. Thank you.
Thank you, Secretary General Dr. Thiruvaiyam Mogan sir. Now I invite the Honorary State Finance Secretary Dr. Solomon Jaya sir for felicitations.
Good evening, sir. Respected Organ Committee Chairman Dr. Rajesh Babu sir, President Dr. Sridhar sir, Secretary Dr. Thiruvaiyam Mogan, Past President Dr. Sangutan sir, and Sukumar sir, and Ophthalmic President Dr. Sujatha Mogan sir, and all the delegates and the leaders. A warm good evening to all. It is the good step taken forward to increase the awareness among public about the organ donation. Dr. Rajesh Babu sir, once given a task, he will be he's very energetic and dynamic. He will be doing to the extreme extent, and he will make it a successful one. We hope. We wish the program a success. Thank you, sir.
Thank you, the Finance Secretary Dr. Solomon Jaya sir. Now we will straight away go into the program. Now I invite Dr. Kosalram sir to take over the session and conduct the meeting.
Good evening, sir. Very warm welcome to all of you. Today's meeting is initiated by Rajesh Babu sir, considering that the need for establishing Eye Retrival Center. And today we have a star speaker, Dr. Sujatha Mohan ma'am, who is the Medical Director, Rajan Eye Care Hospital, and also the President of the Tamil Nadu Ophthalmic Association. Ma'am is a chief facilitator of Chennai Vision Charitable Trust, also a specialist in phaco, corneal transplant, and refractive surgery. She is the director of the Rotary Rajan Eye Bank, and she has presented several papers in national and international conferences. She has been specially trained by Dr. Harminder Singh Dua from the UK, and she has more than 25 publications, conducted more than 500 eye camps under the aegis of Blind Free India project launched by Chennai Vision Charitable Trust. Was adjudged one of the two top women ophthalmologists in the country in the year 2009, and was awarded the Agarwal Gold Medal for the best women refractive surgeon by Srimati Sheila Dikshit, Chief Minister of New Delhi in 2010, and was awarded the best video on refractive surgery in APCRS, and won the Dr. G. Sita Lakshmi Gift of Sight Award from the Lions Club of International on Helen Keller Remembrance Day awarded Dr. Nataraja Pillai Best Paper Award at Shankar Nethralaya Alumni, July 2018, and authored the Color Atlas of Cornea book released by AOS during March 2024. Moreover, she has been a huge inspiration for all ophthalmologists like us, and we're looking forward to your talk, madam. Thank you, ma'am.
Good afternoon, everyone. At the outset, I'd like to thank Dr. Kaushal Ram, Dr. Rashmi, and particularly Dr. Rajesh Babu for making this possible and giving me this opportunity. My special thanks to our own ophthalmic fraternity, President IMA, Dr. Sridhar, and all the others who are here, Dr. Nirmal Fredericks, Dr. Sukumar, and Shirish, and so many of us, and also the office bearers of the IMA. So with this few words, I'd like to thank you once again for giving me this opportunity. And I hope I do justice to what you want me to do. So I'll just be sharing my slide. It's visible?
Yes, ma'am. It's visible, ma'am.
Yeah, okay. Thank you. So so corneal blindness, when you look at the corneal blindness in the world, is about 2.2 million people are blind in both eyes. And this is a 223 WHO global statistics, which tells us that 2.2 billion people are blind. And the preventable blindness in this, like cataract and refractive errors, from 1 billion. 5.1% of these people have corneal blindness. 1.4 million children have blind. 70,000 donations are received each year. And the Eye Bank Association of America has collected 141,735 eyes in 2024. When you look at the recent Indian statistics, which is in 2025, there are 4.95 million blind people in India. 1 to 2 million are corneal blindness. 0.24 million are blind children. And 25 to 30,000 new corneal blindness is added on every year. And eye donations we receive are only 25 to 50,000 every year. 1 lakh cornea is needed every year, and the EBAI, or Eye Bank Association of India, targets at least 1 lakh donation by the year 2030. So corneal blindness, when you look at corneal blindness, there's 6 lakh blind children in India, and the ocular trauma is responsible for 20 to 40% of the one eye blindness. Corneal opacity is 27% of the corneal blindness. When you look at the economic burden of blindness and loss of gross national, the estimated loss of gross national income is 845 billion rupees. This was a study done by Manava et al. And published in Indian Journal of Ophthalmology in 2022, where they estimated a blind person, because of the blindness, the estimated loss of gross national income is 845 billion rupees, and per capita loss was 1,70,000 odd rupees. The loss of productivity due to visual impairment is 646 billion rupees. You can look at the enormity of the problem when you look at this economic burden of blindness. So what is an eye bank? It's a non-profit organization which deals with the collection, storage, and distribution of cornea for the purpose of corneal transplantation, research, and supply of other tissues for other purposes. So the eye bank is a 3-tier system in which the eye bank training centers are on the top, followed by the eye banks and the eye donation centers. So let's look at each of them. What are eye bank training centers? They not only harvest and process tissue, but they are also into creating awareness, public awareness. And more importantly, they are the main places which train the skill and upgradation of eye bank personnel. So this is one of the most important functions of an eye bank training center. So they are able to pass on the skill to several eye banks. Next comes the eye bank, which is a middle tier, which comprises the eye banks. The organizations that comply with all the regulations stipulated by the Eye Bank Association of India, which includes tissue harvesting, collection of blood for serology, processing and distribution, creating public awareness, and hospital corneal retrieval program. So our eye bank, the Rotary Rajan Eye Bank, is part of this eye bank, the second tier of the eye bank. The eye donation centers should provide public and professional awareness of eye donation, coordinate with donor families and hospitals to motivate eye donation, to harvest corneal tissue and collect blood for serology, and ensure safe transportation of tissue to the parent eye bank. So recovery and retrieval, cornea processing and distribution. This is how it works. The contraindications for collection are patients with AIDS, rabies, active viral hepatitis, death from unknown cause, congenital rubella, septicemia, and leukemia and other blood disorders. Ocular disorders such as retinoblastoma, conjunctivitis, iritis, congenital anomalies, central opacities of the cornea, or the prior refractive procedures are not absolute contraindication. So steps of eye donation, donor selection is very important. This is followed by tissue retrieval, the examination of the cornea, transplantation of the tissue, and storage of the corneal tissue and distribution. So donor selection, you have to look at the age of the donor. No influence of age on corneal transplant outcome has been noted. This is by one of the study which was done and published that showed that the effect of donor age in penetrating keratoplasty for endothelial disease and graft survival after 10 years showed that there was no influence of age. The older the age, the usage rate usually declines, and lower limit is usually 2 years to prevent myopic shift after keratoplasty, and also because the corneal rigidity is very low and it will be very difficult to suture these corneas. So medical history is very important. Eye banks must have consistent policies for the examination and documentation of donors, available medical records, medical history, cause of death, medications, and laboratory reports. And tissue retrieval can be either in the form of enucleation, in which there's this complete surgical removal of the whole eye, or it can be in situ, where only the corneoscleral rim is excised, retaining the globe. So the preliminary preparations are, first and foremost, you have to obtain legal permission. You can see the voluntary donation consent form here. Go through the donor's medical records for any contraindication. Wash hands and be prepared for an aseptic removal. Draping, etc. should be done as you would do for a surgery. Identify the donor. Collection of postmortem blood, which could be from the femoral vein, subclavian vein, heart, or jugular vein. It's very, very important to collect the blood, because if there is no serology, we cannot use the tissue. So enucleation is done by first doing a conjunctival peritomy, disinserting all the muscles, and then making a cut on the optic nerve and completely removing the globe, which is stored in a moist chamber. Corneoscleral rim excision would consist of making an incision about 3 to 4 millimeters away from the limbus, and going circular all around and removing a circular rim of corneoscleral rim. So, and this is also stored in a medium. So you can evaluate the donor tissue in several ways. Gross examination would consist of looking at the whole globe. Patients with excessive stromal hydration should be discarded unless specular microscopy can be done for endothelial cell count. If you have a corneoscleral button, color of the tissue storage media is to be noted. Yellowish color indicates contamination and should be discarded. So these are the criteria that you look for when you are after harvesting the eyes, whether it is excellent, very good, good, fair, or poor, based upon the presence or absence of epithelial defect, the clarity of the stroma, presence or absence of arcus senilis, presence or absence of Descemet's membrane folds, and endothelium. So how do we evaluate the donor eyes? So these eyes are placed in a medium, in a temperature-controlled refrigerator, and a special specular microscope with a special bowl is placed inside, and distilled water is poured into the bowl, and the corneoscleral rim with the endothelium facing downwards is placed into the bowl. And with high magnification, the specular the specular microscopy of the cornea is done. So based upon the amount of tissue edema or the presence or absence of cells, you can see that whether you can count the number of cells. And you can see here the count is about 2,288, which indicates that the cornea is very good. And this is how we do the cell count in using a donor specular microscope. After this, the storage, once you've harvested the tissue, the storage can be either a short-term, intermediate, long-term, or very long-term. And short-term storage is usually in a moist chamber. Intermediate, we used to use MK media, modified MK media. Long-term storage can be used with organ culture or cryopreservation. Moist chamber storage, the disadvantage is that the tissue has to be used immediately within about 48 hours. And it is usually stored at 4 degrees inside the fridge. And it's important to keep it in a closed container with a moistened cotton gauze. And the container should not be filled with fluid. The advantage is it is very simple. And if you have patients in the waiting list, you can call them immediately and operate. But however, most of the times it may not be possible because a patient may be unfit, the recipient may be unfit, or may have to wait for a longer time. So it is always better to transfer them into a media where we can retain them with good viability for a longer time. So intermediate storage media provides chemically defined and stable environment, helps support and enhance metabolic activities, reduces the stromal swelling, keeps the tissue under sterile conditions till use, and provides time for the eye bank to serologically screen the donor for communicable disease. The ingredients in the media could be dextran, chondroitin sulfate, electrolytes, pH buffer system, antibiotics, essential amino acids, antioxidants, insulin, endothelial growth factor, antiproteases, and anticollagenases. So dextran is used to keep the cornea thin. Initially, we used to use 5% of 5 molecular weights. But now in the newer media, we have 1% of 40,000 molecular weight. Chondroitin sulfate is a very important component because it is akin to the naturally occurring glycosaminoglycans in the cornea. It's available from the different types of chondroitin sulfate are available from different sources. And a high molecular weight chondroitin sulfate maintains the detergents, whereas low molecular weight helps retain viability of the endothelium and also acts as an antioxidant. Macrey-Kaufman media, which was used for a long time, which is no longer used because of we have better preservation media, contained a 5% dextran along with TIC199 and also penicillin and streptomycin, which was later substituted with gentamicin. The modified media had the HEPIS buffer, which was less toxic and also had phenol red as a pH indicator. The storage period in the MK medium and modified MK medium is about 4 days at 4 degrees centigrade. Now, most of us are using cortisol, which contains chondroitin sulfate, dextran, streptomycin, sodium bicarbonate, base culture media, L-anyl glutamine, vitamin B12, phenol red indicator, recombinant human insulin, and purified water. The middle and lower level illustrations here in this show that varying degrees of magnification, the snail tracks or stress lines, which can happen if the tissue is not handled properly. So looking at the eye banking statistics in India, the target of eye to be collected is 55,000. Number of donated eyes collected in 2021 was 17,402. And the total of keratoplasty procedure was performed was 11,859. From 2021 to 22 up to August 26, the target is 60,000, but collected eyes is 45,000, and keratoplasty procedures performed was 24,000 and odd. So functions of the eye bank are functions of the eye bank: tissue evaluation, tissue preservation, distribution, public awareness, and research. Distribution of cornea is done only to hospitals and ophthalmologists registered in the HOTA. Maintenance of waiting list, distribution of record, feedback from the hospital receiving the cornea is very important so that we know whether the cornea has been used and to what purpose. Donated sclera can also be used for glaucoma and oculoplastic and retinal surgeries. Human amniotic membrane can be used for other ocular surface procedures. Fair and equitable distribution of transplantable tissue to corneal surgeons according to the waiting list is very important. Legal aspects are under the Transplantation of Human Organs Act 1994. MBBS doctors can do enucleation. Eye donation is decided by the close relatives and not by the actual donor. Legal written consent is required before removing the eyes. At this point, we have to remember that the eye donation is done after death and not before, like in kidney transplant and other organ transplants. So the written consent or the legal written consent of the donor will not be valid because it may be too late by the time we decide. So it's the closest relative who has to accept. If there are 3 or 4 close relatives or siblings, which one of them do not agree, then the eyes cannot be collected. National Eye Donation Fortnight is celebrated every year between 25th August to 8th September, where we hold painting competition and a lot of awareness competitions, quiz competitions, eye donation rally is held throughout the state. So this is a video showing how penetrating keratoplasty, which is a very simple procedure, can save a patient's vision. So after the initial trephination using about a 7.5 millimeter trephine, the diseased cornea is removed. This is a patient with pseudophakic bullous keratopathy. And the edges of the cornea, the recipient cornea is trimmed, and a small peripheral iodotomy is being done. And high density viscoelastic is put to just protect the cornea, which is going to be replaced. And the donor cornea is placed and fixtured. So normally we do 16 interrupted sutures in case of a full thickness penetrating keratoplasty. Till about 2 decades back, almost for more than 200 years, this was the only procedure done in the cornea for corneal transplantation. But since the evolution of lamellar keratoplasty, we have had many different methods of doing corneal transplant based on which part of the eye is affected. So this is a post-op. And this is a patient undergoing Descemet's membrane endothelial keratoplasty. In this, the endothelium, along with a little bit of the posterior stroma, is prepared from the donor, and the diseased endothelium of the recipient is stripped using a reverse Sinski. As you can see here, the patient has had a phaco done already. So this is a patient with Fuchs endothelial dystrophy, where the patient has already undergone cataract surgery and the lens has been implanted. And now the Descemet's membrane is stripped for about 8 millimeters. And usually in Fuchs endothelial dystrophy, it comes out very beautifully as a single strip. In patients who have scars, it not be so easy to remove it. Once it is done, then we'll have to constrict the pupil, do an inferior peripheral iodotomy. And this is a prepared tissue. As you can see, this is only the endothelium and the posterior stroma is removed. And using push-through technique, the endothelium with the stroma is transplanted. And an air bubble is placed under the disc. The graft is centered. And the air bubble is left in place for about 10 to 20 minutes. And once endothelial pump starts acting, then we can burp the air bubble a little bit, keep a central air bubble so that the graft attaches. So this is the pre and the post-op. And this the next type of endothelial keratoplasty is DMEC, or Descemet's membrane endothelial keratoplasty. Is only the endothelium alone is transplanted. So after a phacoemulsification, you can see that the stripped Descemet's is placed in a small cartridge, and it's marked. It's important to make sure that it's on the right side. And usually the endothelium rolls inwards. So in the graft, actually the endothelium is on the outside. And so it's very important that we place the graft on the proper side. And you can see now that S mark that we have placed is facing in the right direction. And once you have unfolded the graft, an injection of air is placed to attach the graft to the recipient. So advantage of DMEC over DSEC or endothelial keratoplasty is that the chance of rejection is very much reduced. However, it's got a slightly steeper learning curve. But now I think more and more corneal surgeons are shifting to this type of endothelial keratoplasty. Here you can see the S mark, which is on the right side. So this is what you examine. Just make sure that there are no folds in the Descemet's membrane which has been placed. So the last procedure I'm going to show you is deep anterior lamellar keratoplasty, which we normally use for tectonic conditions such as advanced keratoconus, patients with dystrophy, or patients with scar who have only in the anterior surface of the cornea, where the endothelium can be spared. So the reason why endothelium needs to be spared is because endothelium is the most sensitive or immunogenic of all the layers. And by retaining the patient's own endothelium, the chance of rejection gets very much reduced. A big air bubble is formed now, and a little amount of aqueous is released. And now a slash is made on the roof. And you can see that the air bubble has separated the descemetes from the rest of the stroma. And using a blunt varnish, the top layer which we want to remove is gently dissected and removed, and the descemes membrane is exposed. So the advantage of doing this procedure is the patient's own endothelium is left behind, and chances of rejection is also very much reduced in this case. So now you can see by quadrant, the anterior layers of the cornea that is removed, and then you can see the shining layer which is seen underneath is a descemes, patient's own descemes membrane. Now we transplant the cornea in which the descemes membrane of the donor is removed. So in cases where we do a DMEC, we can actually retain those eyes for doing a DALK as well. So that the endothelial layer is used for endothelial keratoplasty, and the top portion is used for deep anterior lamellar keratoplasty. Once this is done, then we use interrupted sutures and finish the graft. So this is some of the patients with pre and post Dalk. So our own eye bank, the Rotary Rajan Eye Bank, was started in September 1996. It's important to have an NGO along with you because the project actually accelerates very well if you have an NGO holding hands with you. This was a project of the Rotary Club of Madras Nagar along with Rajan Eye Care Hospital, and is registered with the Eye Bank Association of India. It's also a member of the International Federation of Eye Banks as a van to transport the eyes and full-fledged team, and also a donor specular microscope. So till date, we have done about 2,000 odd corneal transplants, and most of the patients have been done free of cost or only cost to cost. We have more than 50,000 pledges, and this is some of the eye donations that we have received. We have done for patients who have lived as far as who have come from Siliguri through the Rotary contact. You can see this patient lost his eye when he was 3 years old to smallpox. And once he got the transplant, then he has been under follow-up for more than 15 years with us with excellent visual acuity. So the eye donation rallies are some of the things that we can improve the awareness. So this we have been doing since 2001 for the past 25 years. Also distribution of citations, like what Dr. Rajesh Babu was saying was using celebrities, like we had Muthaiya Muralidharan, we have had Vijay Amitraj, and a lot of cricketers who have come just to boost and show them the happiness that we've received the eyes, and the thankfulness and gratitude to the donors. So these are some of the rallies. And also we have had a painting competition year after year for children to promote the awareness about eye donation. So finally, I would like to thank once again all the office bearers of Indian Medical Association, President, Dr. Rajesh Babu, our chairman, and the panelists for taking the time off and also giving me this opportunity. And miracles cannot cure the blind, but you and we can. Thank you.
Thank you, ma'am. It was simply superb and a very, very well said lecture, ma'am. So actually, before we started, actually, my co-moderator, Dr. Reshmi, wanted to say something special about madam. So I also wanted to say that ma'am is a Nari Shakti Purushkar awardee, which is one of the highest civilian award in the country, ma'am. So Reshmi, over to you.
Very nice.
Thank you, sir. Sir?
Madam,
Yeah.
that was a very nice lecture, madam. I have learned a lot of new points also. Beyond, I am going on conducting this meeting, but I have learned a lot of new points this time.
Thank you.
Thank you for your thing, madam. But we have a lot of queries about the retrieval centers and the iBank. That we
Yes.
will, in due course, we will be asking you and
Sure.
we will share you the experiences. And
Sure.
now I request Rashmi madam to talk.
Good afternoon, ma'am. Ma'am, this is an absolute fan moment for me, and absolute pleasure and pride to speak to you and listen to you always. And you are a real motivator. And you know that I know you for years together.
I
Yes,
know.
yeah. So I have a few lines for you, one or two lines, and nothing is exaggerated. Absolutely
Sure.
what I feel for you. So here it goes. She'd be a crowned empress, composure of a princess, and a stature of a queen. No looming shadows, no waiting other self. Going forward, she knew she would be a balance of all pieces. Somehow, some way, she could be many things all at once. Our most dearest, multifaceted, multipotentialite, ever graceful, charismatic, inspirational, and magnetic, madam.
Thank you. Thanks a
Thank you,
lot.
ma'am.
Really nice of you. Thank you.
Thank you so much, ma'am.
For good lecture. We'll have a panel. So let me introduce our panelists today. So the panel will include Dr. Nirmal Frederick, who has just arrived. Sir is actually past president of Tamil Nadu Ophthalmic Association. Now he's presently the IMA AMS chairman of IMA Tamil Nadu. Sir has done the prestigious TNA Dr. Joseph Jnanadikam oration and has been is a pioneer in NABH. We look up to him. He has developed exclusive eye standards, edition 1 and 2, an NABH assessor, and he has been so supportive for TNOA as well as IMA. Welcome you, sir. The other panelists will be Dr. Sirish Kumar, who is currently the cornea consultant at Eye Foundation Coimbatore and president of Coimbatore Society of Ophthalmic Surgeon. He has won numerous awards, notably the Shiva Prasad Award in AOS and the Captain C.P. Gupta Award. And he's a very good friend, and he is up for any eye donation activity. He's always there. The other panelists will include my classmate and friend, Dr. K.S. Siddharthan, who runs the IMED hospital in Coimbatore. And he is a corneal surgeon par excellence. And he has done pioneer work in lamellar and DMEC keratoplasties. And he'll be sharing his insights today. And also today with him will be Prabhu Vijayaraghavan, who's a cornea consultant in Shankara Eye Care Hospital. And he's held up in the theater. He said he will join soon.
I'm here,
And
sir.
we
I'm
have,
here, sir, already.
yeah, he's already
Yeah.
there. Thank you, Prabhu. And we also have Dr. Sumati ma'am from the government side. Sumati ma'am is the head of the Department of Ophthalmology in Coimbatore Medical College. Ma'am is comes for all the inspections of DBCS, and she has graduated from MS from Coimbatore Medical College, and she is eye bank inspector also. So from the government side also, we'll have somebody who can contribute. And also today we'll have Dr. Shalini, who is the cornea consultant, eye bank director of Aravind Eye Hospital, Coimbatore. So, these are the panelists today, and so I'll get the questions straight across. So the first question is in IMA we are in the process of developing eye retrieval centers. We have planned one eye retrieval center in Coimbatore and in Sivagasi. So when we are taking such a lead from the IMA side, and there was one pertinent slide from Dr. Sujatha ma'am, which said that as per the as per the legal perspective, even the doctors are permitted to do enucleation. So this is the main idea by which we are pursuing this. And so what do the panelists feel on eye retrieval centers? And how do you feel the eye retrieval center concept is the preferred role of eye banking in the present day era? And how do we strengthen this? First question to Nirmal sir.
Thank you, Kaushal. The outset, let me thank the Organ Donation Committee headed by Dr. Rajesh and the entire team for organizing this important webinar. I also thank Dr. Sujatha for the wonderful lecture, giving a overview of this entire corneal donation program, eye donation program. So IMA, why IMA taking up is very important because the network leverage. So we have about 4,500 plus hospitals in the nursing home board. And if we can convert these member hospital into feeder collection center, so even if 25% of those hospitals take up this initiative, so we'll be having a huge leverage and impact on the entire eye donation program. So in that, we can have MOU with the existing eye bank, and we can also use our paramedical wing and the AMS wing for training and capacity building. And yes, like one member said, a lot of restrictions and government permissions. We also need to channelize these permission to ensure they are helpful towards forming retrieval centers and IBAN rather than being a restrictive role. So we also need to improve our policy and advocacy, work with the government to ease the restriction and initiate appropriate legal measures. Of course, we have enough resources, human resources, but we also need funds for that. I think NPCB also need to rake up the funds, the support of at present they are giving 2,000 for eye donation, but this considering the resource required, it may not be adequate. So we need to ensure these things are properly thought, budgeting done, and accordingly the NHM and NPCB improves their budgeting towards corneal donation program. Apart from that, I think you asked about the HCRP in promoting eye donation. So hospital retrieval program is very, very important because we get good eyes, young eyes, and these are the people and families that can be easily integrated into the retrieval program. So for that, we need to have certain alert mechanisms wherever death happens within 15 minutes. The retrieval center and the eye bank has to be alerted. And so we, since it has this hospital death, we have the medical records, and we also know the contraindications and relative contraindications. You certainly get a good eye. And counselors in the hospitals, they have to be trained for this, especially the grief counselors. They should meet the family within 30 minutes or so and try to convince them about not only corneal donation, but also the other organ donations. And obviously, they have to be supported by the leadership within the hospital so that the entire program goes on a green channel mechanism. So if there are any other ideas, we can take up. Thank you, Kaushal.
Thank you, sir. Nice you elaborated on it, particularly on the hospital cornea retrieval program. So I have a question to Sumati madam, because you are in Coimbatore Medical College, government institution where you have a lot of deaths happened. Is it possible to, how challenging is it to get eyes from the Coimbatore Medical College? Do you have any grief counselors there, or how is the organ donation? Because the organ donation is pretty functioning in a very big way in Coimbatore Medical College. The dean conducts a weekly meeting, and she meets all the donors for the other transplant. So how do you go do it, ma'am?
Good afternoon, all of you. Actually, government setup, we don't have a grief counselor, but we have got a help from the NGO. One NGO from Coimbatore is attached to our hospital. So with them, we have made a tie-up. So they have provided a grief counselor, and she goes to all the wards like IMCU, trauma ward, where it's prone for like deaths, untimely deaths or whatever it is. So she's supposed to go to all the wards in the morning and see if there's any patient who is very sick, and anytime they could declare death. So she comes and informs us, and our postgraduates also, they go and see the patient and they start counseling. And apart from that, the most important thing is to get police permission in the case of an RTA. That is very difficult because within 6 hours, if you want to take the eyeball, the most important thing in RTA is to get a police permission. This is difficult when a person who is shifted to this tertiary care hospital, for example, from places like Pollachi or from Tirupur district. So first they would have entered the Tirupur hospital, but then due to the severity of the trauma, they would refer the patient to our hospital. In such condition, by the time the police comes here, it's very late. So what I request the IMA is if they could coordinate or with the Commissioner of Police and to bring out some solution so that some arrangements could be done. So the patients, police could reach the spot before 6 hours after we declare it. That is very important thing. And one more thing I want to tell is that Dr. Chandrasekhar from Telangana, he was asking about getting permission and all. That is actually not the function of the DME. The permission has to be got from the DMS. In our state, of course, for any setup of new eye bank or new eye bank inspection, it comes under the DMS. So if they could approach the DMS, I think that it will be easier, and that is the correct. Thank you.
Okay, madam. Yeah, I think RTA cases, if we get a clear-cut green signal, it will be easy for us to tackle this issue because we might, similar to eye, we might get also the other organs also. They are in huge demand also as well. But I think we need to work on this, and we can ask Rajesh Babu on this, on how to proceed in this particular way. So thank you, madam. The next question is to Dr. Sirish Kumar. Dr. Sirish, how do you think it is challenging to start an eye bank, and because right now how difficult is it to get a licensing for the eye bank also? Not audible.
Please unmute yourself, sir.
So thanks a lot, Kushal, for involving me in this, and my sincere thanks to Dr. Rajesh Babu. See, like as a private practitioner, when I started working in Coimbatore, I had a lot of difficulties to get a pair of eyes. Like I'm a trained cornea surgeon, but it is very difficult to get corneas for corneal transplantation. There were two functioning eye banks at that time in Coimbatore city, but they used to collect, and it used to be utilized by them. And there's hardly any eye bank which was giving us any tissues. So nowadays things have changed. We have a central networking, central eye banks, and site life. They all like join together and they collect these eyes and distribute it to the needy surgeons. Of course, we have to register ourselves or our hospitals with the State Human Organ Transplantation Act, and HOTA license has to be there for performing the surgery, and HOTA license has to be there for the hospital to start this corneal transplantation procedure. But nowadays it is become little better, and like of course we have to pay the processing fee for these eye banks, but we get good quality tissues. So in that way, like networking definitely helps, and we ask for a good quality tissue, like it's not that all the time you need a good quality tissue. For penetrating keratoplasty or for DSEC, DMEC, you definitely need a good quality tissue. And for therapeutic purpose, you need not have a A-grade cornea, or for even Dalk, it need not be A-grade cornea. A B-grade cornea itself is sufficient. So by requesting these networking agencies, and Site Life is one such initiative, and from where we are getting these tissues on demand. And it's like it is serving almost most of the private practitioners who are not able to have an eye bank. But the thing is, eye retrieval center, it is nothing, it's not a eye bank, it's a retrieval center, it's a smaller center. It's also called like eye donation center, which doesn't require costly equipment. Even a eye hospital can have a small eye retrieval center or a eye donation center, wherein you collect these tissues and do the basic evaluation. You need not have costly equipments. You evaluate the tissue by your torchlight examination or a slit lamp examination. And if you have a corneal surgeon in your hospital, and if you have a patient for corneal transplantation, you can use it, or you can send it to a nearby eye bank. Don't waste the tissue, send it to a nearby eye bank. And these eye banks, through the network, they can send it to the surgeon who wants these tissues. And for starting this eye retrieval center, eye donation center, you don't require any major infrastructure. It is a simple procedure. Like you need like certified technicians, or even the eye surgeon who can go and retrieve these corneas, or even a trained technician can do this. And you just need some coordinators to connect with the nearest eye bank. So in that way, the utilization can be improved, and you need not waste the tissue if you don't have a patient.
Okay, Suresh. I think you have beautifully summarized. Uh, I, I think now you have got your hospital has lot of peripheral centers. I think
Yeah.
they have you have more people outside also, Metropolitan and other areas where they are doing, I believe. I
Yes. Yes.
have and they send then the corneas. So I think by every hospital, by your message on that every hospital can start a retrieval, have a retrieval center, adds
Retrieval center.
more value to this eye donation movement. So now I'd like to ask Dr. Siddharthan. Dr. Siddharthan has been in an institution, in a huge cornea institution. Now, plus the last 4 years, he's on his own, and he has got licensing for conducting keratoplasties. He has got a full-fledged HOTA license in his hospital, and he's planning to start a. They are planning to start an eye blank in Erode, and in which he's one of the members involved in it. Siddharth, can you elaborate on what sort of work you are doing and how challenging it was when you started?
That sir is there or not? He's not there, I think.
I think if Siddharth is not there, I'll ask the question to Sujatha ma'am itself. Sujatha ma'am, can you tell, like, how do you started your dream project, the Rotary Rajan Eye Bank, which we have heard a lot about? Can you describe this in 5 sentences, and how you initiated and how it started?
Yeah, actually, I would have to accept that it was a brainchild of Dr. Mohan Rajan. We joined the Rotary in 1993, and so we wanted to do something which is equivalent to what Lions was doing, because Lions was the main thing. We're doing so much of eye donation. And Rotary had absolutely nothing to do with eye donation. So that was the concept Mohan had when he wanted to do this eye donation. So we started with that project, and we put it forward to our president. They were also very eager, and they accepted it. And so what we did was to get a matching grant, we traveled to several countries. One being Canada, we visited 12 clubs in the period of about a week. So we traveled nearly about 5,000 kilometers, driven by one of the local Rotarians, and we presented about eye donation and the need for support for a matching grant. And majority of it was in Canada and a little bit in the US. And so once we got the matching grant, we started the Rotary Rajan Eye Bank. So it was a combination of effort from Dr. Mohan and also the effort from the Rotary to put it forward. And our club, which is a Rotary Club of Madras Tinagar, president was very much willing to participate in that. And that's how we started small. And then how we promoted it was that we kept on holding awareness campaigns. And the people who donated their obituary comes free of cost. It's being borne by the hospital. And not only that, for people who donate from ashramam, where there is nobody to take care of their the last rites, the hospital supports it. Our Chennai Vision Charitable Trust supports it. And also we had contacts in ICUs in the hospital and other hospitals, and used to go immediately throughout. We had a van which was operating 24 hours, 365 days, and an eye bank team which was doing it. So this is how we motivated everybody to and projected ourselves. And not only that, whenever there was a celebrity in town, we used to call him and give citation to the donors and read up about and tell about the eye donation. So once a donor, a celebrity like Vijay Amitraj, Muthaya Muralidharan, Gavaskar, so many people have come and they've spoken about eye donation. So it definitely splashes in the paper, and so the increase in the eye donation awareness comes in. And also Shankar Netralaya also made a video with Rajnikant and Dr. Natarajan made with Aishwarya. So we also had eye donation campaigning done like that. And we started the rallies in 2001 where we assembled at the beach and called a celebrity to flag off the rally. And we used to have 1,000 people coming for the rallies, and they were creating awareness not only amongst the locals but also like people who are in the beach stand by and watch, and the colleges, going to the colleges and talking about it. So that is it was done as a very, very slow step, and step by step we started doing it. And the more important thing was because it was a project with the Rotary. People who couldn't afford, we did it free of cost, totally free of cost. And people who could afford, we definitely took a marginal amount of money. But compared to outside, definitely our services were available much cheaper than the outside where corneal transplant was done. And this is how we built up our eye bank.
Yeah, that was really great, ma'am. How, compared to the earlier, like how challenging is it to start eye bank as of date?
I think now it is more streamlined, actually. See, if you are interested in starting an eye bank, you have to first get a HOTA. So they have certain important things, like you have to have your own microbiology lab, you have to be affiliated to a pathology lab, and you have to have a corneal surgeon who is a trained corneal surgeon. Basically, you should have a certified corneal surgeon. So if you have all the demands that they have, and which can be very easily met, it's not very difficult, then you apply for it. It may take a while because they don't come immediately. As soon as you apply, they don't come for inspection. The inspection takes time, and we have to keep telling them, no, we're waiting for inspection, we're waiting for inspection. Then once they come and inspect and they're happy with the whatever we have, our thing, then you automatically get it. So the protocols have to be followed, and getting HOTA is only more of a bureaucracy. If you have everything in place, the time taken may be about 3 to 6 months. But you ultimately you get it. But if you don't, if you fall short and if you're not having the enough credentials that they want, then it may be difficult. But I think over a period of time, it's much more easier because we know what they want, and you can definitely make arrangements for that.
Thank you, ma'am. Prabhu Jeragon, are you on time?
Yeah, sir. I have a few points to share, sir. First of all, I would thank Madam for giving an extremely completely covered talk on corneal blindness, and especially only an experienced person can talk about the financial burden of it and the per capita issues which is involved with the such a kind of a blindness, which is very, very important one. Thank you, Madam, for bringing out all those points, and Madam completely covered the topic from a complete penetrating keratoplasty to a thin 10 micron transplant DMEC for an IMA general surgeon's talk like this is extremely important to know how far we have improved in the transplant over years. So two things which I would like to add is one. I think nowadays the iBank, the working style has improved, and it is very well improved and when compared to the before. And now I think the prospect what I see forward is one. Am I audible, sir? Yeah. Hello.
Sir, audible, yes, sir,
You are audible.
Something which I see forward is when compared to the abroad, I think there are people who are working with pre-cut tissues. Now that corneal transplant, 80% of the time is a lamellar transplant, either anterior or the posterior lamellar transplant, and almost all the developed countries have moved to the next level from iBank to pre-cut tissue preparation and pre-cut tissues being distribution. So probably next 5 years we will also be working in that scenario where the iBanks are it becomes a responsibility of the iBank also to prepare the tissue for what exactly the surgery is meant for. Probably that will be the next step, and I would definitely look forward for it. And then next important thing is the HCRP. HCRP is an excellent program. It has been proved in many fields that the HCRP corneas are extremely functionally very good, and the success rate of using a HCRP cornea has been really proved. So probably HCRP program has to pump in as much as possible. And for the HCRP program, mostly the problem is with the trauma and the MLC cases. As Sumati Madam correctly pointed out, we also discussed this in our IMA and Coimbatore eye donation meeting also. We have already discussed, and we have put forward to Rajesh Babu sir to find out some solution for finding out, because the problem is the RTA has happened somewhere about 50 kilometers or 100 kilometers away from the tertiary care hospital where the deceased is being taken up for postmortem. Before postmortem, if we have to take up the police and the other clearances are required, that is where the delay happens. And probably if government is able to come up with some of the streamlined shortcuts to give clearance early, and then we will have much more utilization in the HCRP program. These are all my points, and I thank once again the organizers and IMA for including me into this, sir.
Now I request Dr. Shalini Madam, the Aravind Eye Hospital, to give her views about this eye retrieval centers and eye donation.
Good evening, sir. Thank you for giving me this opportunity. So, am I audible?
Yes, madam.
Yes, sir. The one I think so Aravind Eye Hospital has been running for the past 29 years. So the one thing which we as ERC should be is the consistency, like the staff which we take should be consistent commitment to the iBank also. So if you train some person, they should be like stay bank with iBank for at least 5-10 years. That is more important if we start in the ERC and all. And we have Dr. Madam here, and she would like to give us some inputs about the same.
Yes,
sir, retrieval centers initially initiated by Madurai Aravind Hospital in Coimbatore and Kumbakonam and Tanjore district areas. And it was, as Dr. Sujatha Mogan pointed out, Lions played a very great role in that. And some of the IMA doctors, general surgeons and others, they took initiative and they also did it very well. And here in Coimbatore, as a great example, we have one in Nekarapatti. Dr. Balasubramaniam, an IMA member, as well as a personal interest. Because of his personal interest, he took this and started an eye collection center. So such champions, if they are there, definitely it will work out very well. And these eye collection centers are, I think, going for an eye bank as such is for private, single surgeon places, clinics. It may not be very effective. Unless you have such a large number of patients and you have energy and support. But eye collection centers can easily be done. And especially if IMA can step in, it will be a great success. Because so far, these things are more, we relied on the NGOs like Rotary and Lions. But if IMA can step in, that's going to be a great success. Eye collection centers by is the support of IMA, because we need the doctors' help, the local doctors, because we have done it in Pollachi. Dr. Omana used to help us a lot. Pollachi, Udmalpet area, though she is a general practitioner. Whenever we get a call, immediately she used to go and attend. We left our set of instruments, everything with her, and she used to go immediately and collect. Because even if the lines contact from Coimbatore to that place to reach, it may take time. So she used to do that and then send. Same thing Dr. Balasubramaniam used to do. So that way, and that is one point, a collection center with the help of IMA definitely will work out very well. And the next one is making a network, what Dr. Sirish pointed out. Instead of relying on, I think if I am correct, Sight Life has gone out of this networking distribution network. So instead of relying on some private people, each big centers like Coimbatore, Pollachi, and Erode, this area, if all the major cities from the major eye hospitals, if we can form one major eye banks, we have a lot of eye banks within this area. If we can make a network and distribute tissues to the people who are even the private practitioners, but who have HOTA and properly trained, that also will solve a lot of problem of proper distribution and reduce the wastage of corneas.
Thank you, madam. The way in which you are telling about all the points were very excellently taken off. I like to know that whether Dr. Balasubramaniam is available, because I have asked him to join. Dr. Balasubramaniam is there? Sir, Dr. Balasubramaniam? It's not there. There is one more activity which was happening from Dharmapuri area. There is Dr. Pandikumar, ophthalmologist, is there. Pandikumar sir is there? Pandikumar sir?
Yes, sir. I am here, sir.
Yes, sir. Yes, sir. You tell your experience, because you are from one of the peripheral centers. You are coordinating and doing. How you are able to manage it? Because the main aim of doing this program was, we have eye banks in cities, in Chennai, in Trichy, in Madurai, in Coimbatore, like that we are having. But we are not having in small areas on peripheries. Only when you are going probing like that, we are able to know some of the people who are available, like that is happening. So how come you people are able to create a retrieval centers in your region? How bold you were able to do it? That type of a people only are needed, and the guidelines from the Aravind Eye Hospital, because they were the pioneers in doing it, and also Sujatha madam, who is already doing very nice eye bank work. So we want some guidelines in future. We will have a separate meeting of our office bearers once again, and then we will discuss in detail how to go about it. So each and every step, if they guide us, we can select the ophthalmologists who are interested in each and every branch of IMA, and then make them to do this retrieval work. That's the main aim of creating it. Because we have 175 branches in Tamil Nadu, even at least 25 branches are doing it, it will be a big boon. That is the main thing. So, yes, sir, Parikumar, sir, please.
Good evening, everyone. I'm glad to introduce myself as an ophthalmologist in Dharmapuri. We have started eye donation forum, registered with Eye Bank Association of India 15 years ago. And we have collected so far 336 pairs of eyes. And I'm an ophthalmologist. My wife is a non-ophthalmologist. She's a family physician, but trained at LV Prasad. And we both have collected so far 336 pairs of eyes. Mainly with the support of local Lions Club. We are grateful to the Lions Club of Dharmapuri, especially to Mr. J.P. Nagarajan, Mr. Munirasan, and Mr. Jagannathan, who have shown personal interest in harvesting the eyes so far. And personal interest is what is important that we feel in our scenarios. Sir. During COVID, we had a dip, but then after COVID also, we are unable to pick up the speed with which we were working earlier. So now we are continuing to harvest eyes from Dharmapuri district, in and around Dharmapuri district. And most of the eyes, 90% of the eyes were sent to Arvind Eye Hospital, Coimbatore, and to Lions Eye Bank, Bangalore.
Sir, did you face any legal issues, sir?
So far, we didn't face any legal issues, sir.
Sir,
Everything was smooth.
That's what the other doctor who was talking from Nalgonda, he was telling a lot of things now, sir. So whether we should be worried about all these things, because when there is an MOU between this ophthalmic association and the doctor and the hospitals, then it will be very easy, I think. That is the main thing, because you are telling that with ophthalmic association, the MOU and the Eye Bank MOU, you were able to do the things very nicely, no, sir. That's
Yes,
what we want, the experience of you people like this, so that we will be able to do more of the work. Because we wanted to, we will have the retrieval training centers to do more of the people in each and every zone. We are trying to plan for it, sir. So I request your help also, sir.
Yeah, running a retrieval center is not an issue, sir. It's a very easy
That
thing.
is what,
Only
sir.
we need
That's why we are creating this, sir. That
yes,
is why
sir.
we are starting. Because in 175 branches, we have at least 25 to 50 branches. Ophthalmologists are willing. Then it will reach a long way. As you people are asking, we will give you more eyes than the other things. That is the main thing.
See, ophthalmic assistants are now certified to remove their eyes, sir. So we can train actually ophthalmic assistants and each set up small eye donation centers, collection centers. And so you can keep them on call all the time and give them an incentive so that whenever they go, whenever they collect one eye, you should give them some incentive. So they can be trained to collect how to remove the eyes. See, nowadays the problem what we face is almost everybody is on blood thinners. So once you cut the optic nerve, there's so much of bleeding which comes. So you have to be equipped with bone wax and everything like that. So nowadays, I would suggest if you can go for a corneoscleral rim dissection, that will be more comfortable for the person who's doing it as well as for the family, because the whole eyeball is not being taken. That is one way of looking at it. But if the whole eyeball needs to be taken for the reason that we may need sclera or other things, then we'll have to be equipped to deal with these excessive bleeding. So sometimes we go collect the eyes and then they come and they call us again, tell us that the eye is still bleeding. Because all of them, almost everybody over the age of 50 is on blood thinners. So these things also have to be taken into consideration, sir.
Yes, we faced similar situations.
Sir, what's that?
Sir, if I may...
Sir, your experience about that bleeding, sir. Your experience about that bleeding, you tell.
Yes, we have come across with similar situations and we had excess bleedings and we handled all these with wax.
Bone wax.
Yes.
With bone wax, it will stop, madam.
Yeah, we take the bone wax, but sometimes, even with bone wax, sometimes it keeps on bleeding. So my eye bank technician who's been retrieving eyes for the past 30 years now, is 1996. He is 60 years old. He was holding on to the eye for 40 minutes, pressing on the eye for 40 minutes. So things like that happen, but very rarely. But we have to be prepared for all these things.
Exactly.
Dr. Balasubramaniam sir is here. I think we can ask. He has a very different technique to stop this bleeding.
Sir, you please unmute yourself, sir.
Are you able to hear me?
Yes, sir.
Yeah. Really commendable that you are able to organize such a meeting so that more people take interest in corneal retrieval. The main thing is, at the time of death, if the grief counselor is able to convince the person that they can donate the eyes, that is the best thing. So, in all intensive care units or a family physician, whoever is there, if he is able to convince, then I think it will help in retrieving more corneas.
Sir, Dr. Balasubramaniam from Nekarapatti is also here.
Sir, Balasubramaniam
Sir,
sir,
please.
நீங்க சொல்லுங்க அந்த bleeding எப்படி arrest பண்றீங்கன்னு சொல்லுங்க sir.
Sir, please unmute and
please unmute yourself, sir. Please unmute yourself.
Unmute பண்ணிருக்கப்போ are you able to hear me?
இன்னும் வரல இது unmute ஆகல திரும்பி போயிடுச்சு. Please unmute yourself.
Hello, are you able to hear me now?
Yes sir.
Yeah.
No, திரும்ப போயிடுது.
The moment you know the patient has been on some anticoagulants, etc., you have to raise the head end of the bed so that the blood drains itself. Then there will not be much bleeding. That is one thing that we do. The other thing is you can have sutures. You can put the area after you have removed cut the whole eyeball and cut the optic nerve. That area you can suture with the black silk and then apply formalin soaked cotton into the socket. That will reduce the bleeding.
Sir, instead of Dr. Balasubramaniam, I can share. He used to soak cotton in kerosene and press it on the thing. And he says always it stops the bleeding. Even I think some of our doctors also they try this, and I used to get scared because it's kerosene, but he used to tell no, this will work definitely, and because he has done lots and lots of enucleation for us, and he used to tell this technique.
Sir, Balasubramaniam sir, நீங்க சொல்லுங்க. R Balasubramaniam sir, உடுமல்பேட். Sir, please unmute பண்ணுங்க. சார் பாலசுப்ரமணியம் சார், ஆர் பாலசுப்ரமணியம் சார், அன்மியூட் பண்ணுங்க சார். கேட்க மாட்டேங்குது. Sir, Mr. Jagannathan sir is there. Mr. Jagannathan audience is there. Jagannathan.
Sir, Siddharth irukara. Dr. Siddharth.
Mr. Jagannathan.
Yes, Kaushal. Irken Kaushal.
Yes, sir. Siddharth, on the challenge in starting IMA Retrival Center.
நீங்க சொல்லுங்க சார். உங்களை கூப்பிட்டுருந்தோம். You were busy with the surgery. So, sir, Mr. Jagannathan is there. Jagannathan is there.
Yes, sir. Yes, sir. I am very much here, sir.
Sir, Siddharth sir, 1 minute our patient.
Yes, sir. Yes, sir.
Jaganathan sir is one of the person who is very much interested in doing the eye. He is having some eye forum through which he is mobilizing this event. I request him to tell his experience because people like them only are going to coordinate more. Please tell sir. Jaganathan sir. Jaganathan sir.
Sir, can you hear me, sir? Can you hear me, sir?
Yes, sir. Yes, sir.
Good evening, everyone. This forum. I myself, Jagannathan, a volunteer from Dharmaburi Eye Forum. Our counterpart, Dr. Parikumar, is also here. We are very happy to be in this juncture. As the previous people that they have shared about the experience in retrieving the eyeballs and facing the consequences. how we handled it is like we had a good rapport with the local people, especially in the villages. We do have members from Lions Club, Rotary Club, as well as other non-governmental organizations. So we have a smooth rapport with them, and we educate them. We tell them about the do's and don'ts periodically. Every time, whenever we get a chance to talk about eye donation, we educate them how to react once we get an eye call, how to avoid consequences and confusions. So all the technical aspects will be retrieved in the first phone call itself. So once we make sure that the call is genuine and it's eligible for the eye retrieval, we communicate with the medical team. Our Dr. Parikumar sir will be always there. He's working with us for the past 18 years round the clock, as well as his wife, Dr. Shobana Parikumar, doctor. They are very helpful to our organization, this Dharmaburi Eye Forum. When it comes to the legal issues, see, the concern is only thing is we get the concern from the family members. That is one of the most vital document as far as our concern. So for the past 18 years, whatever we have faced, we have gone to all the remote tribal villages, taluk, and everywhere. We have come across different kind of problems as well as we have overcome with that. We always go with the influential people from the local community. So they will help us to retrieve the eyeball without any hassles, because since they are very influential in that area, rather it is a tribal village or it's a remote village or it can be a taluk, whatever you name it. When you go with the influential people, they will talk for us, they will talk on behalf of us, and they will tell the family members the importance of eye donation. There are at present, like, we are living in a society where we have different kind of superstitious belief about eye donation. So we had improvisation in terms of educating them. So we've been constantly talking with sorry, sir.
No, sir. No, you can't.
Am I audible to everyone, sir?
Yes, sir. Audible. Tell me. Continue.
So the legal issues, we have a good rapport with everybody in terms of transport as well as the non-governmental organizations and everything. So the only legal document what we possess at the time of harvesting an eye call is like have a proper consent from the family members. That is, one document is sufficient for us for all these years. The hassle-free transportation of the eyeball to the as of now we are acting as a retrieval center, and also we also work with the local body that Dharmaburi government hospital has an eye bank as such. So whenever we get time, we also work with them, and currently we have a good rapport with Arvind Eye Hospital, Coimbatore, and we also streamlined the transportation of transporting that eyeball. As of now, we don't have a good connectivity directly to Coimbatore. So what we do is we have a tie-up with Arvind Eye Hospital Salem branch. So once we harvest the eyeball at the condolence place, we pack it with proper medium and everything. We send the transportation. So every 5 minutes we have a good connectivity. So we send the eyeball to the Salem branch, and we also communication is the most important part in this entire process, because each and every moment is very valuable. So one miscommunication will put you into a mess. So you have to be a proper send the eyeball with the proper packing as well as with the proper documentation is the most important part. That shows the genuinity of the whole process. So with the proper documentation and proper packing, we send it to Arvind Eye Hospital Salem, and volunteers and the staff members from the Salem branch, they immediately they will make a switch over the buses to Coimbatore. So within from the time of harvesting the eyeballs, say about like 6 to 7 hours, we'll reach the eye bank. So that is how we've been working constantly for the past 18 years. And till now, we have, I think our Parikumar doctor has mentioned that we have completed around 336 corneal harvesting so far.
Thank you so much for your valuable points which you have given. And we will
Thank you,
come
sir.
back to you because we are having a lot of experience in this, so that
Yes, sir.
we will have some model and then we will do it, sir. Thank
Definitely,
you
sir.
for
Thanks for the
participating, sir.
opportunity.
Thank you, sir.
Thanks for the opportunity.
Now I invite Dr. Sujatha, sir, to give his views.
Sir, Dr. Balasubramanian Udulpet, I am more than 1,000 pairs he has removed.
Hello, sir.
சொல்லுங்க.
ஹலோ
சொல்லுங்க சார்,
சார்
சொல்லுங்க.
பாலசுப்ரமணியன் சொல்லுங்க.
கேக்குதுங்களா சார்? சார் நான் வந்து
பாலசுப்ரமணியன்
ரெட்ரீவல்
சொல்லுங்க.
சென்டர் எந்த லைசன்ஸ் எல்லாம் ரெட்ரீவல் சென்டர் ஆரம்பிக்கிறதுக்கு வேண்டியது இல்லை.
அத சொல்லுங்க முதல்ல.
ஒன்று. ரெண்டாவது வந்து நம்ம இப்போ அரவிந்த் ஹாஸ்பிட்டல், சங்கர் ஹாஸ்பிட்டல் மாதிரி இருந்தாலே அவங்களுக்கு நம்ம தான் ரெட்ரீவல் பண்ணி அனுப்புகிறோம். அதே போதுமானது சார். அதே மாதிரி இங்கே வந்து ஃபீல்டு ஒர்க் இஸ் வெரி வெரி இம்பார்ட்டன்ட். ஏன்னா எவ்ரி வில்லேஜ் வி ஹேவ் டு கோ, எவ்ரி டெத் ஹவுஸ் வி ஹேவ் டு கோ. அங்கே போய் நம்ம அவேர்னஸ் உருவாக்கணும்னா கண்டிப்பாக வந்து அவங்க ஐ டொனேஷன் எடுக்கிறதுக்கு அனுமதிக்கிறாங்க. நம்ம எடுத்து இது பண்ணுறோம். நான் இதுவரை 4,000 பேர் ஆஃப் ஐஸ் எடுத்திருக்கிறேன். மேடம் சொன்ன மாதிரி ப்ளீடிங் வந்து நிறையா வந்து பிரச்சனை இருக்குது அப்படின்னாங்க. ஆரம்பத்தில் நான் அதெல்லாம் மீட் பண்ணேன். ஆனால் அது கெரசனை வச்சு தான் நம்ம இது பண்ணுவோம். கெரசனை வந்து மாப் பண்ணி சோக் பண்ணோம்னாலே ப்ளீடிங் அரெஸ்ட் ஆயிருங்க. அரெஸ்ட் ஆகிட்டா நம்ம சூச்சர் போட்டு விட்டுலாம். இமீடியட்டாக வித்தின் 2 minutes அது ப்ளீடிங் அரெஸ்ட் ஆயிடுது. அதனால் அது வந்து நம்ம பெரிய பிரச்சனையும் எனக்கு தெரியல. அது வந்து மற்ற ரெட்ரீவல் சென்டருக்கும் மற்ற ஐ ஹாஸ்பிட்டலுக்கெல்லாம் நான் சொல்லிட்டு இருக்கிறேன். ஈவன் ஈரோடு எல்லாம் போய் நான் ஸ்பீச் கொடுத்துருக்கிறேன். இந்த மாதிரியெல்லாம் அது ரொம்ப நல்லா நடக்குது. ஆனால் வந்து ஃபீல்டு ஒர்க் வந்து இம்பார்ட்டன்ட். ஏன்னா அதில் வந்து நம்ம இம்பார்ட்டன்ட் பர்சன்ஸ், இன்ட்ரெஸ்டட் பர்சன்ஸ் வந்து நம்ம வந்து மோட்டிவேட் பண்ணி அவங்க இது எனி டெத் இருந்தால் அவங்க சொன்னோம்னா நம்ம உடனே அங்கே போய் மோட்டிவேட் பண்ணி ஐ டொனேஷன் எடுக்கிறோம். அந்த மாதிரி தான் செஞ்சிட்ருக்குறோம். வேறு உங்களுக்கு என்ன வேணும் சார் இதில்?
இல்ல, உங்க அனுபவத்தை தான் நீங்க சொன்னதுதான். 3-4 பாயிண்ட் ரொம்ப இன்ட்ரெஸ்டிங்கா சொன்னீங்க. அது வந்து அதே போதும். நீங்க 4,000 பேர் கை கொடுத்து எடுத்திருக்கீங்கன்னு சொல்றீங்க. அது ஒரு பெரிய
ஆமாம் சார்.
விஷயம்.
இது வந்து நானே தான் போய் எடுக்கிறேன். என்னுடைய லைன் மெம்பர்ஸ் இன்ட்ரெஸ்டட் பர்சன் என்ன கூட வந்து டே அண்ட் நைட் என் கூட வர்றாங்க. அந்த மாதிரி
சார் எவ்வளவு வருஷமா பண்ணிட்டு இருக்கீங்க சார்?
சார்
எவ்வளவு வருஷமா பண்ணிட்டு இருக்கீங்க?
25 years சார். 1997 இருந்து பண்ணிட்டு இருக்கிறேன்.
வெரி கிரேட் சார். தேங்க்யூ ஃபார் யுவர் வேல்யூபிள் ஃபீட்பேக் சார். நீங்க சொன்ன இந்த கெரசின் இது வந்து நாம வந்து இம்ப்ளிமெண்ட் பண்றதுக்கு பார்க்கலாம் சார்.
ஓகே சார்.
தேங்க்யூ சோ மச் சார். உங்க கிட்ட திரும்பி வந்து கேட்போம். லாட் ஆஃப் கைட்லைன்ஸ்
எப்போ வேணாலும் கேளுங்க சார். இந்த சர்வீஸுக்காக
we will be able to throw தமிழ்நாடு உங்கள மாதிரி ஆட்களை தயார் பண்றதுக்கு பிளான் பண்ணிட்டு இருக்கிறோம். அதுதான் எங்களுடைய
அதே மாதிரி இப்போ ரீசன்ட் பீரியடா ஒரு 5 years வந்து ஸ்கின் டொனேஷனும் பண்ணிட்டு இருக்கிறோம் சார். இங்கே கோயம்புத்தூரில் கங்கா நர்சிங் ஹோம்னுக்கு அழைச்சி நம்ம இதே வித்தின் 6 hours நம்ம ஐ டொனேஷன் எடுக்கிற மாதிரியே ஸ்கின் எடுக்கணும். அதை வந்து நாங்கள் அதுவும் பண்ணிட்டு இருக்கிறோம்.
தேங்க்யூ ஸோ மச் ஃபார் யுவர் வேல்யூபிள் ஒர்க் சார்.
ஓகே சார். தேங்க்யூ சார். தேங்க்யூ
சார். ஒரு தடவை எடுக்க போயிருந்தப்ப ஸ்டெப்டோகைனஸ் இன்ஜெக்ஷன் அப்பதான் போட்டிருக்காங்க. அவர் இறந்துட்டாரு.
சரி.
பாடி எடுத்து கண் எடுத்ததுக்கு அப்புறம் ப்ளீடிங் வந்துகிட்டே இருக்குதுங்க. அங்க இருக்கிறவங்களாம் சுத்தினே பார்த்துட்டே இருக்காங்க. எனக்கு என்ன பண்ணுறதுன்னு தெரியல. போட்டு ஏதோ வச்சு அமுக்கி அப்புறம் போடணும். அப்பதான் போட்டிருக்காங்க. அதுக்குள்ள அவர் இறந்துட்டாரு. அதனால அது நல்லா
இல்லை சார். அது இது வந்து யூஸ்வலாக வர்றதான் சார். நம்ம ஹார்ட் பேஷண்ட் மற்ற இதுக்கெல்லாம் வர்றதான். அதனால அது கெரசின் வந்து பெஸ்ட், நல்ல விதமா வேலை செய்யுது சார். எனக்கு
இந்த பாயிண்ட் யாருக்கும் தெரியாது. சொல்லிட்டீங்க.
நம்ம காசு வந்து சோக் பண்ணி கெரசின்ல உடனே நம்ம கம்ப்ரஸ் பண்ணிட்டு அது மேல வந்து ட்ரை காஸ் வச்சுட்டு உடனே சூச்சர் பண்ணிடலாம். அதான் பெஸ்டா நான் இது பண்றேன். நம்ம கன்வீனியன்ட்டா இருக்குது எனக்கு இது. தேங்க்யூ சார். சுமார் சார்.
தேங்க்யூ ஃபார் யுவர் ஃபீட்பேக் சார். எஸ் சார். தேங்க்யூ சார். டாக்டர் சுஜாத் சார்.
தேங்க்யூ சார். தேங்க்யூ சார்.
எஸ் சார்.
எஸ் சார். சித்தார்த் சார், யூ கேன் டாக்.
அதான் சார். அதே இப்போ சார், தேங்க்யூ ஃபார் காலிங் மீ சார். சாரி ஃபார் ஜாயினிங் லேட் சார். இது என்னன்னா, இப்போ வந்து மோஸ்ட் ஆஃப் தி கார்னியல் ஒர்க் வந்து இன்ஸ்டிடியூஷன்ஸ் தான் நடக்குதுங்க சார். மோஸ்ட் ஆஃப் த கார்னியல் ஒர்க். ஸோ பிரைவேட்டா கார்னியா பண்றவங்க ரொம்ப கம்மி தாங்க சார். ரேவதி மேடம் சொல்ற மாதிரி ஐ பேங்க்ஸ் வந்து ஆல்ரெடி நிறைய ஐ பேங்க்ஸ் இருக்கு. ஸோ நிறைய ஐ ரிட்ரீவல் சென்டர்ஸ் ஷுட் கம். ஸோ அந்த ஐ ரிட்ரைவல் சென்டர்ஸ் வந்து வரும்போது மோஸ்ட் ஆஃப் தெம் ஆர் அட்டாச் டு பிகர் இன்ஸ்டிடியூஷன்ஸ் லைக் அரவிந்த் சங்கரா அந்த மாதிரி இன்ஸ்டிடியூஷன்ஸ் இருக்கும்போது ரிட்ரைவல் சென்டர்ஸ் வந்து நிறைய இடத்துல இப்போ நீங்கள் சொல்கிற மாதிரி நிறைய இடத்துல வரும்போது இட் கேன் கிவ் பெட்டர் ரீச் டு பீப்புளுங்க சார். ஒன்று இப்போ கோஷல் வந்து என்ன ஷேர் பண்ண சொன்னால், இப்போ நான் வந்து வி ஆர் இந்த ப்ராசஸ் ஆஃப் ஸ்டார்டிங் அன் ஐ பேங்க். அவர் சுகுமார் சார் அவர்லாம் இன்வால்வ்டு. ஈரோடில் வந்து வி ஆர் ஸ்டார்டிங் அன் ஐ பேங்க். ஆல்மோஸ்ட் 2 வருஷம் ஆச்சுங்க சார். போராடிட்டு இருக்கிறோம் கவர்மெண்டோட. இந்த இதை கொண்டு வாங்க, அதை கொண்டு வாங்க, இதை கொண்டு வாங்க. இந்த சோ மெனி நார்ம்ஸ் இப்போதான் வந்து ஃபைனல் ஸ்டேஜ் ரீச் பண்ணியிருக்கோம். ஸோ அதனால் இன்னைக்கு வந்து ஒரு ஐ பேங்க் ஆரம்பிக்கிறது வந்து இட் இஸ் நாட் ஈஸி சார். இட்ஸ் வெரி டிஃபிகல்ட் டு ஸ்டார்ட் அன் ஐ பேங்க். ஸோ ஏகப்பட்ட ப்ராசஸஸ் யூ நீட் டு அண்டர்கோ கவர்மெண்ட்டோட இதில். ஸோ அதனால் உங்களோட ஐடியா centers, retrieval centers will retrieval centers will work out very well, sir, and it's a good idea. Whatever help I'm ready to give, sir.
We will sit together, we will plan together, and we will come out with the nice protocols. What we இப்ப பேசுறதுல வந்து தெரியுது என்னன்னா சார், only thing is we should have an MOU with all the people who are involved in this. That is the ஐ பேங்க்ஸ். எல்லா ஐ பேங்க்ஸுக்கும் வந்து நீ நான் சொல்லி போட்டி போடாம நான் என்ன சொல்றேன்னா, எல்லா ஐ பேங்க்ஸுக்கும் we should have an MOU with the persons who is involved in this program. Then it will work out very nicely, sir.
Yes,
we
sir.
can give it to them, they can give it to us. அந்த மாதிரி we can do it, sir. It will be working very nicely, sir. Only thing is we need to talk with the people who is very much interested, who are in charge of the people. For example, அரவிந்த்ல யாரு கீ பர்சன் பார்க்கணும், who is in charge, like that in ஐ ஃபவுண்டேஷன், லைக் தட் இன் அகர்வால்ஸ், எல்லாருமே வந்து யார் யார் கீ பர்சன்ஸோ அவங்கள வந்து நாம இன்வால்வ் பண்ண வச்சுட்டு நம்ம பண்ண அட்லீஸ்ட் வந்து ஒரு 25 சென்டர்ஸ் அட்லீஸ்ட் இஸ் த மெயின் எய்ம் ஃபார் மீ டு டூ த திங்ஸ். தட் இஸ் த மெயின் திங் சார்.
கண்டிப்பா சார், கண்டிப்பா.
ஸோ வி வில் பிளான். அண்ட் ஆல்சோ நீங்க வந்து சொல்ற பாயிண்ட்ஸ், நீங்க வந்து ஐ பேங்க்குக்கு எவ்வளவு கஷ்டப்பட்டிருக்கீங்கன்னு சொல்றீங்க. ஸோ இதையெல்லாம் வந்து நாம ஒரு ப்ராசஸ் பண்ணி கரெக்டா வந்து எல்லாருக்கும் என்ன பண்ணணும்னு சொல்லி ஒரு பிரான்ச்ல இருந்து ஒரு 2 ஆப்தால்மாலஜிஸ்ட் இன்ட்ரெஸ்டடா பண்ணாங்கன்னா, ஒன்லி திங் இஸ் இனிஷியல் ஸ்டேஜஸ் கொஞ்சம் மணி செல் அவுட் பண்ண வேண்டியதா இருக்கும். அது வந்து ஒன்றும் பண்ண முடியாது. நம்ம வந்து கண்ணு வந்து ஹெல்ப் பண்றவங்களுக்கு மணி கொடுக்கணும், டிரான்ஸ்போர்ட்டேஷனுக்கு மணி கொடுக்கணும், அந்த மாதிரி எல்லாம் வரும். ஸோ வி ஹேவ் டு ஸ்பெண்ட் சம் மணி வித்தவுட் நோயிங் வாட் வி ஆர் கோயிங் டு டூ. பட் இந்த ப்ராசஸ் வந்து கொஞ்சம் கொஞ்சமா ஸ்டார்ட் பண்ண we will also feel the bread of it. That is the main thing, sir.
Sure, sir.
ஆமாங்க சார். Thank you, sir.
Sir, with a humble request regarding the eye donation, sir.
சொல்லுங்க.
Is it better to merge with other organ donation with eye donation? இல்ல செப்பரேட்டா இருந்தா பெட்டரா, கம்பைன்டா இருந்தா yield பெட்டரா?
எல்லாமே பண்ண போறோம் சார். இது வந்து ஐக்கு வந்து இத்தனை ஆப்தால்மாலஜிஸ்ட் இருக்காங்க அப்படிங்கறதுனால அது வந்து மெயினா அது வந்து ஒரு சிம்பிள் ப்ரொசீஜருங்கிறதுனால இது ஆஃப்டர் டெத்னால இதை வந்து ஒரு ப்ராசஸாக ஆரம்பிக்கிறோம். ரெஸ்ட் ஆஃப் த திங்ஸ் ஆல்சோ வி ஆர் திங்கிங் இன் டர்ம்ஸ் ஆஃப் இட் சார். இப்போ நான் போட்ட இந்த பேப்பர்ஸ் இதே பாத்தீங்கன்னா, இது 26ஆம் தேதி ஒரு டொனேஷன் நடந்திருக்குது கோயம்புத்தூர்ல, 25ஆம் தேதி ஒரு டொனேஷன் நடந்திருக்குது, 24ஆம் தேதி தஞ்சாவூர்ல ஒரு டொனேஷன். இந்த மாதிரி பாத்தீங்கன்னா தமிழ்நாட்டிலேயே வந்து இந்த மந்தே வந்து ஒரு 20 டொனேஷன்ஸ் நடந்திருக்கும் போல இருக்கு.
Very good, sir. Very good.
Going on, sir. அந்த அளவுக்கு மெசேஜ் ஸ்ப்ரெட் ஆயிருக்கு. பட் only thing people should be willing to come out. That is the main thing. Causal.
Sir, audible, sir. Sir, this is
சொல்லுங்க.
The question to Revathi madam and also Sumati madam, if
உங்க வால்யூம் கம்மியா இருக்கா?
If from Coimbatore Medical College, we are ready to help you, sir, provided you help us with the logistics, sir. We have got
மேடம் நம்ம உட்கார்ந்து எல்லாம் ஒர்க் அவுட் பண்ணுவோம் மேடம். நல்லா.
Okay, sir. Thank you. We are ready.
நேர்ல வந்து பாக்குறோம் மேடம், நம்ம உட்கார்ந்து பேசுவோம் மேடம், நம்ம வந்து ஒர்க் அவுட் பண்ணுவோம் மேடம். இப்படிதான் மேடம் பண்ண முடியும்.
Thank you, sir.
Rashmi madam, anything you want to tell?
ஹலோ
மேடம் சொல்லுங்க, நீங்க ஏதோ சொல்ல வர்றீங்களா?
இல்ல சார், ஆக்சுவலி டவுன் சவுத்ல கொஞ்சம் பிராக்டிக்கல் டிஃபிகல்டிஸ் இருக்கு. நான் சொன்ன மாதிரி லைக் ஹவு மெனி டாக்டர்ஸ் ஆர் ரெடி டு லைக்
மேடம் நம்ம யாரையுமே வந்து கம்பல் பண்றது இல்லை மேடம். வில்லிங்னஸ் இருக்கான்னு கேக்குறோம் மேடம். அதுக்கப்புறம் நாம அவங்களுக்கு வந்து ட்ரெயின் பண்ணலாம் மேடம். அவ்வளவுதாங்க மேடம்.
அந்த அசோசியேட்டட் ஜிஹெச் மாதிரி கொஞ்சம் இது பண்ணி தான் சார் பார்க்கணும். இங்க
பண்ணிடலாங்க மேடம். மேடம் இப்போ பாலசுப்ரமணியன் சார் வந்து 4000 டொனேஷன் எடுத்திருக்காருன்னா எப்படி எடுத்திருக்க முடியும்? அந்த மாதிரி தான் வச்சுக்கோங்களேன் எக்ஸாம்பிளுக்கு.
எனக்கு வந்து எல்லாரும் சார் எல்லாம் எப்படி பாலசுப்ரமணியன் சார் எல்லாம் எப்படி பண்றாரு அப்படின்னு பார்க்கணும். லைக்
அதுதாங்க மேடம். அவரை கேட்டு எல்லாம் வந்து வில் கெட், அவரை கேட்டு எல்லாம் வந்து நாலேஜ் வி வில் கெட் இட்.
Okay,
அதுதான்
sir.
நான் சொல்றேன். We will have a program in his place itself, and then we will start doing it. அந்த மாதிரி we will start doing and working it.
Okay, sir.
சார் இந்த குவாலிட்டி அஷூரன்ஸ் அண்ட் ஐ பேங்க் இருக்குல்ல சார், அதே மாதிரி குவாலிட்டி அஷூரன்ஸ் ஈவன் ஃபார் ஐ ரெட்ரீவல் சென்டர்ஸ் கொடுத்துருக்காங்க. ஆக்சுவலாக ஜிஹெச்லேருந்து சர்டன் நார்ம்ஸ் கொடுத்துருக்காங்க. அதில் ஆல்மோஸ்ட் எல்லா சர்டிஃபிகேஷன்ஸும் இருக்கு. லைக் ஹாஸ்பிட்டல் ஃபர்ம் சர்டிஃபிகேட், NHP சர்டிஃபிகேட், ஸ்டெபிலிட்டி சர்டிஃபிகேட் எல்லாமே இருக்குது. ஸோ இதை வந்து நம்ம ஃபெசிலிட்டேட் பண்றதுக்கு சுமதி மேடம்,
சார் நீங்க சொல்றது இந்த சர்டிபிகேஷன் எல்லாமே சொல்றீங்க. இப்ப
எல்லாமே
வந்து
இருக்கு.
பாலசுப்ரமணியம் சார், இப்ப பாலசுப்ரமணியம் சார் போய் எடுத்தாருல்ல, அவர் என்ன சர்டிபிகேட் வச்சிருக்காரு? ஒண்ணும் இல்லாம தான் எடுத்திருக்கிறாரு. அதை வந்து எக்ஸாம்பிளா யூஸ் பண்ணுங்க. அதை தான் நான் சொல்றேன். அவருடைய எக்ஸ்பீரியன்ஸை வாங்குங்க, அவர்கிட்ட கேளுங்க, அவர் என்ன சொல்றாருன்னு பார்க்கலாம். அதைத்தான் நான் சொல்றேன். நாம வந்து இந்த மாதிரி ஒரு பெரிஃபரல் சென்டர்ல வந்து தைரியமா பண்ணணும், போல்டா பண்ணணும். என்ன பண்ணிடுவாங்க அப்படின்னு சொல்லிட்டு அப்படிதான் ஆரம்பிக்கணும். சும்மா வந்துட்டு முடியாது கவர்மெண்ட் யாருக்கு
இல்ல அது போய்
கவர்மெண்ட்
எடுத்து அனுப்பிச்சிட வேண்டியதான் சார், அது ஒன்றும் ப்ராப்ளம் கிடையாது.
ஒண்ணும் இல்லைங்க. இவர் 4000 பேர் பண்ணியிருக்காருன்னா இவர் பண்ண வேலை வந்து ஈவன் IMA கூட நம்ம பெரிய இதா அவருக்கு ஃபெலிசிட்டேஷன் கூட பண்ணல. அதான் ஐ அம் டெல்லிங்.
பண்ணிருக்கோம்
சார். IMA எல்லா அசோசியேஷன் பண்ணியிருக்காங்க. ஹலோ
IMA வந்திருக்காரு சார். IMA வந்திருக்காரு.
நீங்க 4000 பண்ணதெல்லாம் வந்து விஷயம் எல்லாம் வெளியிலேயே தெரியாதுங்க சார். நீங்க ஒரு ரைட் அப் எழுதணும் சார். நீங்க ஒரு ரைட் அப் எழுதி அனுப்பணும் சார் எல்லாருக்கும். That's what I am telling.
சார் ஐ ரிட்ரீவல் சென்டர் ஆரம்பிச்சாத பிராஜன் நம்ம நேரா போய் எடுத்து அனுப்பிச்சிட்டோம், பிரச்சனையே கிடையாது. அது மாதிரி தான் சார் செஞ்சாரு 28 வருஷமா
சார். ஆனா இப்ப வந்து ஐ ரெட்ரீவல் சென்டருக்கு எல்லாமே லீகல்
இப்ப வந்து ரூல்ஸ் ரொம்ப ஸ்ட்ரிக்ட்டா இருக்காங்க சார்.
பெரிய லிஸ்ட் அமைச்சிருக்காங்க சுமதி மேடம்.
எடிட் பண்ண முடியாதுங்களா?
இல்ல இப்ப ரொம்ப ஸ்ட்ரிக்ட்டா இருக்காங்க சார்.
அப்படி அந்த காலத்துல வந்து கூப்பிடுவாங்க, நான் ஓடுவேன் கிளினிக் கூட்டிட்டு அப்படிலாம் வந்து இப்பெல்லாம் முடியாதுங்களா?
இல்ல இப்ப அதெல்லாம் பண்ண முடியாது சார். இப்ப ஹோட்டல் அதெல்லாம் ஆனதுக்கு அப்புறம் இப்ப ரொம்ப இதா இருக்கு.
நிறைய லிஸ்ட் கொடுத்திருக்காங்க சார். ஆக்சுவலி இந்த ரெட்ரீவல் சென்டர்
if we do it now for the long run, it is always better, sir. So
some complaints, some இது வந்துச்சுன்னா organ donation is very difficult to answer to people like government officials.
Biohazard also is a very dangerous condition, so that should be screened, serological testing, all those things we should do it properly.
Actually organ ஐ கார்னியா வந்துட்டு ஆர்கன் மாதிரி எடுக்காம ஒரு டிஷ்யூ மாதிரி எடுத்து கொஞ்சம் ரூல்ஸ் வந்துட்டு கொஞ்சம் இது பண்ணி தந்தா நல்லா இருக்கும். அது ஹோட்டல்ல போட்டதுனால தான் இவ்வளவு பிரச்சனை.
It's always better, sir. We will go through proper channels, sir. We can do it, sir.
மைக்ரோபயாலஜிக்கல் அண்ட் சீராலஜிக்கல் சர்வேலன்ஸ்லாம் ஸ்ட்ரிக்ட்டா எதிர்பார்க்கறாங்க இன்ஸ்பெக்ஷன் ப்ராசஸ்ல ரெட்ரீவல் சென்டர்ல.
அது வந்து என்ன புரோட்டோகால்ஸ் வேணுமோ அது யூஸ் பண்ணி தான் செய்வாங்க. அது வந்து நம்ம பண்றது, அது வந்து நம்ம எப்படி வொர்க் அவுட் பண்றதுன்னு சொல்லி மேடம் கிட்ட டிஸ்கஸ் பண்ணி we will come out with that.
You discuss it Sumati madam and then we'll facilitate. Yeah,
ஒரு வாட்டி உட்கார்ந்து அவங்க கிட்ட
again சிட்டிஸ்ல பரவாயில்ல சப்போர்ட் இருக்கும். நம்ம பெரிஃபரீஸ் எல்லாம் வரும்போது பாலசுப்ரமணியம் சார் சொல்ற மாதிரி நம்ம சார் ஆரம்பிக்கும் போது இட் வாஸ் ஓகே. பட் இப்போ ஐ டோன்ட் நோ ஹவ் இட் இஸ்.
நல்லா பிளான் பண்ணி பண்ணுவோம் மேடம். நல்லா பண்ணுவோம்
with the government, madam.
அத கவர்மெண்ட்ல இருந்து தான் பண்ண முடியும். கவர்மெண்ட்ல ஆமா ஆமா மேடம். எஸ் மேம், எஸ் மேம்.
சரி, ஓகே. கோசல்ராம்.
Yeah. So thank you. I think it's in the whole meeting or eye opener actually.
So இப்போ வந்து ஃபைனலா வந்து சுஜாதா மேடம் வந்து ஒரு கைட்லைன்ஸ் மாதிரி ஒரு 10 பாயிண்ட் சொல்லுங்க. அவ்வளவுதான் மேடம் தான்.
சுஜாதா மேம்
அவங்க தான் வந்து அசோசியேஷன் உடைய பிரசிடென்ட் தமிழ்நாடுக்கு இப்போ.
மேடம்
அவங்க வந்து
சம்மரைஸ்
கைட்லைன்ஸ்
பண்ணுங்க.
என்னன்னு சொல்லி
Sir, before closing, sir, very good evening all. Before closing the meeting, give me 2 minutes time to talk on EBI, NPCB and SCRP, non-SCRP.
Okay sir. First Sujatha madam வந்து கொஞ்சம் சம்மரைஸ் பண்ணிருக்கோம்.
Thank you. Okay sir.
Sir, actually, nowadays I think medical legal problems are rising. So there's always a suspicion amongst the general public towards the doctors. So medical legal compliance is very, very important, particularly in organ donation. And I don't think we can skip it. And I really applaud Dr. Balasubramaniam for doing so many eye donations, collecting so many eyes. and coming forward in that. I think those days are gone. The amount of trust he had in the community is different from the amount of trust that we may have. Each one of us has a different presence in the community. His presence was perhaps, he was very much trusted, but everybody cannot take into a fact that I'm also going to be trusted and just go and collect the eyes. So most important thing is to get the HOTA. Once you get the HOTA, then you can go be either a collection center, or if you're a corneal surgeon, you can make it into an eye bank, and you can distribute your eyes yourself. So these two are the things that is possible, because only bigger centers like Aravind Eye Hospital, LVP, they become training centers also. So my 2 cents is, the very most important thing is to follow the government regulations. It is possible, it's not difficult, it may be a little bit lengthier, but once you have the HOTA, then nobody can question you. So that is my total this thing. Everybody can do it. I mean, retrieving the eyes is not difficult. The most difficult thing is convincing the family. Once you convince the family, doing the removing the eyes, retrieving the eyes, transporting it, keeping it in a medium, everything, it involves a little bit of cost, but it's possible. But going through the normal, correct governmental regulations is probably the most important thing. And I'm sure with IMA getting involved, it's going to be a cakewalk, because once you lay down the rules, but IMA lay down the rules, it will be definitely accepted by the government, because IMA is such a huge body and such a respected body. I'm sure it's not going to be difficult, sir, for you people to go ahead and make these retrieval centers. It's just that, like what you said, no, you have to form a small committee within yourself and aggressively work towards it. I'm sure it will be done. And we are going to be the beneficiaries. As corneal surgeons, we'll be the beneficiaries. Thank you, sir.
Only thing is, we want your help, madam, because you are the president of the Ophthalmic Association. Whichever way you are able to help us, you please try to help us, madam. That's why I am going on trying. Actually, this process was started in, I am as an organ donation committee chairman for 3 years, madam. Now, actually, 3rd year I am running. It was started in 2024 itself, I have started. But because I am talking about the organs and everything from 2010 onwards, I used to talk, and a lot of meetings I have come across. But I thought it will be very much useful, and it will be useful for you people. See, what I am thinking is that in Coimbatore, we started this as a small project, and we are thinking about more. Initially, we thought about the eye bank, madam. Then we gave that up. And then we are thinking about the retrieval centers at least, because by the norms is very tough. So we will go across. So what I need your help is that you spread this message to your ophthalmologist. And as Rashmi madam was telling, there is a difficulty from the south ophthalmologist. So to create the interest in the minds of the ophthalmologist, you do something which will be attractive to them, so that more people will be joining.
Sir, one more thing I want to tell you, sir. What Dr. Sumati said was a very important fact, because this hanging, suicide with poisoning, suicide due to road traffic accidents, accidents causing death, the eyes are very good, because all these are youngsters. And those are the eyes that we have to try to get it. So how do we go about it? How do we go?
Madam, for that we need to go to the government and get the permission from the health ministry. We should get the permission, madam.
Yes, sir.
Health ministry and the police, we have to get a memorandum, so that it will be working up very well, madam.
Sir, if you can form a request, if you can have a request, I will put it through to Dr. Mohan Rajan, who is the Vice President of All India Ophthalmological Society now. So he'll be very much interested in going ahead with this, and we can definitely make a very important break in this. This is one thing, which is very, very important to get those young eyes, which are being wasted. So if you can come up with a request, we can have another small meeting with people who are interested, and then we can approach the government and probably pass a GO about this, because
we will try to get it, madam. Only thing is that now is that it is election process is being started. It is difficult. Once it
The
is
other
over,
thing
only
is,
you can do it.
in most of the other countries, Western countries, it's a presumed consent. So they don't ask for consent. They presume the disease is already consented. So we have to change from consent to presumed consent, at least for eye donation, so that the number of eyes that we retrieve will be much more.
Madam, in our country, the religion problem also is there, madam. That is a very, very bigger thing which is stopping in between, madam. Because regarding this organ donation, the one question is already there in the driving license, madam. At least we have to educate the people to give when the driving license is on, we have to educate the driving school people. The question is there. Whether you are willing to donate organs, yes or no is there. Even if you take your license and see the question is there and the answer also is there. So we should make and I am going to write a letter to the Prime Minister stating that you make it as a rule that stating that it should be made compulsory like a foreign countries. Organ donation should be made compulsory, not only eye, all organ. It is not the right of the human people. It is the right of the government can implement this thing. That they can do it, madam. That they can do it, and it is not at all difficult. Because if Narendra Modi comes and talks, nobody is going to tell. If they make it as a rule, they can make it as a GO also. And also they have to tell that for mandatorily to give a license, you need to you need to accept this organ. Then only we will do it. If they say what they are going to do, they cannot do anything. Initially,
Sir,
there will be opposition
sir,
will be there. After that, it will be corrected.
Sir,
sir, I have one small point, sir. For the RTA, sir, the main, I have been a person who was as a postgraduate also, I have faced this as a fellow, as a consultant, and over years I am seeing. The problem with RTA is there are multiple clearances from the casualty medical officer and other RMO of that hospital. All those things we will get, sir. The main problem is the accident would have happened somewhere else, and the case would have been registered somewhere else, and the police from that point has to come here and give a clearance. That is where the delay is here. So mostly if there is a small bylaw which is being done, that most of the place where the deceased is going to be taken for post-mortem, there will be a local police always attached with all the government hospitals, and if he can give a clearance for eye donation to proceed itself, this will solve, sir. I think that's a point which I have in my mind, and maybe Sujatha madam might be and will be able
Sir,
to
that's what, sir, we will
correct it.
discuss in detail, and when we are discussing 2-3 sittings, then we can come to a
We'll do that,
conclusion,
sir.
and what are all the
Okay.
things we are going to ask the government. We can go from our office bearers, and then we can go and we can
Yes, sir.
get the clearance. That's what we need to do it, sir.
Yes, sir,
Dr.
definitely.
Sujatha, madam, and Dr. Rajan can do it. Well, அதை நம்ம advice கொடுக்கலாம்.
Sir, this HCRP program is very successfully being run in Andhra, I mean now Telangana, and in Calcutta and in Delhi. So those people, they got permission from the government. They could mobilize the government, and the government has sent, as sir said, it should come from the government, and they have given that memorandum, the rule, like, then nobody can object for it. So we have to approach there instead of approaching the local police or local people, police officials.
Madam, what is your name, madam?
Revati, ma'am.
I am Dr. Revati. Oh, video upload.
Oh, Revati.
Oh, sorry, sir. Yes, sir.
Madam, unga phone
Madam.
number?
Madam.
Somebody says. Sir, my phone number, yes.
ரேவதி மேம், இந்த பாயிண்ட் வந்து நிறைய தடவை டிஸ்கஸ் ஆயிருக்கு. ஹைதராபாத் தெலுங்கானால வந்து இந்த ஹெச்சிஆர்பி ப்ரோக்ராம்னால வந்து தேர் ஏபிள் டு கெட் ஐஸ் ஈஸிலி, பட் தமிழ்நாடுல முடியல. சார், இந்த பாயிண்ட் ஹஸ் டு பி அட்ரஸ் சார் நம்ம ஐஎம்ஏ சைட்ல இருந்து.
நம்ம உட்கார்ந்து பேசுவோம். It has a lot of the things we will discuss. Only thing, இந்த மாதிரி ஒரு மீட்டிங் கிரியேட் பண்றப்பதான் எல்லாருமே வியூஸ் சொன்னோம்னா சொல்ல வந்தாங்க. அதனால we have got lot of points now. We will sit up everything.
Kaushal also in Kaushal also in Calcutta. Doctor, if you approach Dr. Basat, He was the ex-president of AOS also.
Yes,
He initiated the program in Calcutta, and they got a very good government support. And the same way, like in Delhi, it's going on very well.
Okay, ma'am.
HCRP. So it should be in Tamil Nadu, because we are leading in organ donation, and it can be done here also.
Okay, ma'am. Definitely we'll take this up, ma'am.
Madam, we will even over 10-15 days, we will sit and talk once again, and then we will come to a conclusion, madam. We can bring our Sujatha madam Zoom we can call and we can discuss in detail, madam. That's what.
Sure.
So if there are no other points, we can wind up, I think.
Yes, sir, I have a point to talk. I need an help from the group, sir.
Chandrasekhar.
Yes, sir. Sir, I am very thankful to all the very
சொல்லுங்க சார்.
இல்ல அவர் பேசிட்டு இருந்தவர அவர் லைன் கட் ஆயிருச்சு. வேற எதுவும் இல்லன்னா we can wind up. That's what I
Hello, sir. I
yes,
need the
tell
attention of
me,
group,
tell me.
I need the attention of group. I wanted to talk on 2 points. One is EBI, NPCB, and SCRP, non-SCRP. All the people are aware of SCRP, non-SCRP utilization part, sir. And since for 1 year, I have been trying to request to plead my government hospital superintendent to follow NPCB guidelines, sir. And no one is caring from the government hospital. And the broad notice of DME, joint director, collector. And EBI also, sir. There are great doctors, I understood, but EBI doctors, because they occupied the chair of secretary and president, treasurer post, they were not in a position to spend time. They were not in a position to direct our letter to government hospital Nalgonda or even the Telangana DME garu, sir. I think if someone can look into the
we will come and help you, sir. Don't worry, sir.
Sir, I have enclosed my last letter, my 24th September letter to 2024 letter in this group, sir, in the chart. If one can see it, sir, a 10th class candidate can understand. As per the NPCB guidelines, it is the superintendent, head of the institution, who has to look after SCRP, who should initiate, who should inform the nearest eye bank when they don't have technicians.
Sir.
And we are asked for that, sir, but no one is caring, even
sir,
from EBI. That is what is the problem, sir.
Surely we will sort out your problem. We will come and help you, sir. Don't worry. Surely, sir.
Okay, sir. You said your number is 93600.
Yes, I will talk with you, sir. Don't worry.
Your number 30094, sir.
Yes, sir. We will discuss in detail, sir. Don't worry, sir.
Okay, sir. And thank you very much for giving. Even I learned many things from all of you, sir, from the discussion. Hope to have another Zoom meeting and let us help together to our own society, sir. Bye, sir. Good day, sir.
In June also, we are having the same IMA meeting, sir. Please join on that time.
Okay, sir. Thank you.
Reshmi madam, conclusive remarks. Thanks. Vote of thanks. So I'd like to thank everybody who has come here. It was indeed a very important meeting or a milestone meeting. There seemed to be a concern for everybody, and all these problems will be addressed. We'll take it up via IMA. And Sujatha ma'am, thank you so much in joining us today. It will become a milestone event for this year. So as we take up everything, thanks Rajesh Babu sir once again for driving all of us and making us work more towards eye donation and everything. And I thank all the panelists, everybody who have come today, and all the participants of the program, Sirish, Dr. Nirmal sir, Siddharth, Sumati madam, and Prabhu, and from Arvind. And I thank my co-moderator Reshmi also, who is also very supportive, and they are planning one in Sivagasi soon. Thank you, one and all.
Thank you.
Thank you.
எல்லாரும் கூப்பிட்டது ரொம்ப சந்தோஷம். எல்லாரும் கோஆர்டினேட் பண்ணி.
Thank you, Dr. Kaushal.
Thank you, sir. Thank you, sir. Thank you.
Thank you, Kaushal.
Thank you.
Bye. Siddharth. வாட்ஸ்அப் அனுப்ப போறேன்.
Thank you, sir.